everybody's using AI to search up their test results, search up their
Yeah.
supplements, search up their lab, I might have said lab results, but like their diagnosis, like the information is there, but I think what is the beautiful thing about health, about medicine, about wellness is that there's really an art to it. There's a
Yes.
nuance to it. And that's where the whole expertise comes in from people like you and I and those other doctors that are running all the tests.
Hello, everyone, and welcome back to another episode of Wellness at the Speed of Light. I am so excited to have Dr. Alexandria Rosa on the program today. She is an amazing person to follow on LinkedIn. I follow her on LinkedIn. That's kind of my primary, format, even though I'm on all channels. But we follow each other on LinkedIn, and I'm always, inspired by what you're doing for your patients. I see a lot of your patient testimonials. You're making tremendous improvements in their lives, and in this day and age, that can't be more important than really trying to help people, guide them on their health journey. Because as we were talking right before we started, people are lost in, in
Mhm.
in today's modern era. They don't know how to take care of themselves. Anyway, thank you for joining us. We're gonna just dive right in here to those things that are we're passionate on a lot of the same stuff.
Yeah, I've noticed that with our content and as I've got to know you through LinkedIn and the things that you post, and you're so right that people are so lost in the healthcare system right now. And I think both of our goals with the people that we work with, it's finding that best quality of life
Mm.
for them because health is so individual. Health looks different for everybody. Everybody is different. And it's allowing them to find their own health path basically and what is right for them. What are they even looking for? Not what, social media is telling us that we got
Right.
to look like and what we got to feel like and what we got to be doing because I've had I have had clients who are very high performers, athletes, but then I have other clients who are like dealing with Lyme disease and chronic illnesses. And I'm like, the goals are totally different for these people. And it's our job to facilitate and bring them to that result that they want. That's going to make them feel like they are really living their best life.
Absolutely love it. I mean, you summarized it beautifully. I mean, the truth is, they really don't have a good grasp. This is just so basic what I'm going to say. It's funny because
Mhm.
the more I do this media stuff, I'm getting more and more basic. Because
Yes.
it's like at the beginning, I get into all these details, but the very basic problem, and I like yesterday, even though we had a big snowstorm here, I still saw a bunch of patients in the clinics, the one that could make it through the foot of snow that we had. But the basic understanding is they really are lacking in guidance in what to do just to overall be generally healthy. And one of the things that drove me into this project, especially with the podcast and the integrative health clinics, is the fact that I would start asking people, patients, they're just right in front of me. Hey, why do you do this? Why do you take this medicine? Why do you have a bag of medicines? Why have you been so sick? Why haven't you not worked out for 30 years? All these things. And I could just see there's just ill, right? All
Mhm.
facets of their life is, I mean, mentally they're struggling, physically they're struggling, their sexual health is bad, all these things. They're complaining about everything. And at
Mhm.
some point, I had to stand up and say, I have to do something. I'm a physician. Yes, I'm a spine surgeon, but I'm so interested in so much more. So I went down this path of like integrative health and biohacking. I know that's your passion. So my question to you is why is the, let's just say, the average person, because I don't want to offend anybody. There's people that have tremendous mastery of their bodies and biohack, they know everything. But why
Mhm.
is the average, right down the middle, the average person, in my opinion, knows
Mhm.
very little outside of just like maybe the basics? They know they should be moving, they know that maybe they shouldn't be eating so bad, and they know that there's medicines and surgeries that maybe can help them. But why is there such a lack of education on the things that we're talking about, like really understanding, like things that you're intermittent fasting, vegan diet, carnivore, all these things, and then all the biohacking, and then just really how to take care of yourself, how to take care of your mitochondrial health, your cellular health, all those things. What's your why I know you see this all the time. Why are people so lost on this subject? I know it's a hard question, but why?
No,
It's there. They don't know.
the answer I'm going to give you, I know, is an answer that is not very sexy, and it's not an answer that nobody really wants to hear or talk about, but it really isn't and I'm not trying to knock anything that you said, because everything that you said is very true and very valid. It's not so much like the lack of education or even the lack of getting the information. Because, honey, we all got a cell phone, we got a
Yeah,
computer. Like, we could get the info. YouTube, like, you can learn everything about your body on YouTube. Now, is it credible or not credible? I don't know.
it's a whole
But
other.
the information is there, right? And like you said, people know what they should be doing. Every person that comes to me, and probably that comes to you, like, knows the things that they should be doing. But I think it's kind of twofold. I think one is around people's standards. I think the standards just for like the average person are very low. Even when we look at like lab work and lab values and ranges, like normal,
Yes.
it's like very bad. Like, is that even good to be there? No.
Mm.
So the standard is just very low. Um, and people carry that over into their health, into their mindset, into their relationships, into every single thing, every part of their life. The standard is very low. And then I just kind of touched on it too, but like the whole mindset part of it, valuing yourself. I think our minds are so polluted with social media, with how we were raised, our culture, our religion, our tradition, like all, like I very similar to you, take a very holistic approach to health. And when I saved my life, when I had all those health problems that we were talking about, the heart failure and the prediabetes and blood pressure and just multiple things wrong with me. Um, Really doing a whole holistic overhaul of my life and really getting deep and down in there and really looking at where are these thoughts, these beliefs, these scripts, these stories, this pattern. Like, I just didn't get here. Like, something has led me to this place where I am in my life. And I think taking a step back, and when people find themselves in a current situation of where they are in their life, like, really examine what led me
Mhm.
to this place where I am right now with this bag full of medicine, with no clue what to do. Like, how did I get here? And having somebody to work with you, that's why there's therapists, that's why there's counselors, that's why there's people like us out there to help people figure this out. And because you don't want to do it alone. You don't want to do it alone. It is so much easier, faster, better to do it with somebody on your side. Like we were talking about, that's non-judgmental,
Mhm.
that is just going
Mhm.
to be there for you. I think that's where a lot of it stems from, and I speak from personal experience on all of that. It's not just stuff that I think about or like thought about or came up with or like, hey, this sounds good. No, like this shit happened to me in my real life and continues to happen to me every single day because I'm a living, breathing
Mhm.
human mother, wife, teacher, provider. Like, I'm all the things. And so this is my lived experience. And I know that this is stuff that is going on right now for so many people. And just knowing that you can take
Mhm.
control of your body, you absolutely can take control of your body, work with your body, not work against it. There's so many, you can do it. You can do it.
You know what? You're absolutely right, and you flipped it around in a really good direction because it is true that the level of standards are low. So just one of the things that I do is there's different ways. Like you can do like let's do an exercise. I posted about this. Like and I just feel it out, right, for each patient. Sometimes I say, well, if you do these things, if you continue to do these things, here's you in the future. So it's like our future self mirror. Let's look in the mirror and now this is you 20 years from now. Do you know how bad it's going to be? Some people need a little bit of that medicine, just in the way I do things. But the way
Mhm.
you said it too about like the standards are great. And I want to talk about Tony Robbins for a second, because there's something he says that you just reminded me of, and it's
Okay.
right on the money. But it's like the rear view, like having sometimes when I see these people that allowed themselves to get to a certain point, and the truth is, it isn't allowing yourself to get to that point, because you know that you're right. You know. Now you might not
Hmm.
know what photobiomodulation is, or what IV
Yeah.
hydration therapy is, or what glutathione is, or NAD. Like you might not know any of that stuff, but you know whatever you're doing is
Hmm.
terrible. But you have the low
Hmm.
standards. So if you look, I talk, those are the people I go in the rear mirror and I say, okay, let's picture you in eighth grade. When you were in eighth grade, did you think that by the time you were 39 years old, that this is what we got going on? Like, because if like depressed, kind of thing, and then they think, no, I never thought this. I don't know. And then we get into how did we get into this? Like, what was it? Was it the food? Was it lack of exercise? Was it exposure to toxins? All that stuff. So I love that. Tony Robbins. So I love what he says about standards. You said it in your way, but what Tony says is he's like, people like they have these low standards because things are shoulds, right? Instead
Hmm.
of being a
Hmm.
must. When something's a must, like it's non-negotiable. And that's what we
Hmm.
talk about, like elevating the standards, how you eat.
Hmm.
I don't mean that people cannot have like sometimes people like, they attack me when I post certain things on social media. They're like,
Hmm.
"Are you saying I should never have French fries?" I got into it one time with this podiatrist. He was like getting so upset with me. I'm like, I'm just talking about Happy Meals and what what they do here. But the truth
Yeah.
is, if it's your must, I must exercise 5 times a week. I must have this much protein every single day. I must, not I should, oh, tomorrow
Hmm.
or this or that. And looking back, I mean, I think that is exactly right. I mean, people don't have the standards. So let me flip it back to you, since you
Hmm.
brought up the thing about having standards. What's your technique? I always love listening to, how do you, like, if you clearly, okay, say somebody is in front
Hmm.
of you, and we get this all the time, and we start this discussion, and obviously it depends. When they see me as a spine surgeon, they're not expecting me to get into the conversation. So I have to just like kind of I got to ease into it. I have to do some small
Yeah.
talk, and then but when they see me like in the integrative health clinic, it's different because they're coming. They know they have an issue. What do
Yeah.
you do when the person is just making constant excuses? Everything's somebody else's fault. It's whatever. Or they clearly, you can't break up. They're there just to tell you all their excuses, and they're just going to walk out without following anything. Like what are your tricks?
So I'm so glad you were asking me because this is exactly where I was going to go.
Perfect.
The one technique that I use, and this is something that anybody watching right now can do, and it might sting a little bit. Like I keep it real, so it might sting a little bit. But this is how I approach the conversation. Um, is if somebody's coming to me with all those stories and they know they're in a bad situation, I make them face what's going on, and I say, what are the benefits to continuing to live this way? What are the benefits? Because you only do things because there's a benefit to them. That's the only reason you do things, because there's a benefit. Is it a now the person might be like, "Oh, why are you telling me that I want to be like this and this and this?" And I'm like, "Well, you're doing things that are causing that. So you obviously see benefits to that. So what are the benefits?" And that's where it takes a whole nother direction where you start getting real and raw and deep into the driving factors behind the behaviors, behind the thought patterns, because you're only doing things because there's a benefit. That's the only time we do something is it's going to benefit us. Because there's two sides to everything, a benefit
Mm.
and not a benefit to something. So why are you engaging in XYZ behavior? And I make a big old list, a list. And finally, it will come to the surface of what's really going on. Because I could tell you to go, you must work, or you could tell yourself, I
Yeah, yeah,
must work
yeah,
out and I must do
yeah,
this and I must
yeah.
this. But like, unless there's a real benefit
Mhm.
behind it, you're not going to do it. You are not going to do it. So that is something that people do not like hearing. They don't like doing, but it's absolutely why you're doing it. There's a benefit to it.
No, it's absolutely true. And that, when I talk to people, for example, that are really unhealthy, and they're coming to me, for example, in my spine clinic. So, I just kind of turn it around. Obviously, if they need surgery or something like that, we talk about that. But overall, their health, we start talking about what are their goals, right? Longer term goals. And so we always
Hmm.
talk about, like, let's say somebody, is in their 50s. We just start talking about, well, do you want to maintain your mobility? Like, what are your driving factors? Do you want to be there for your children, for your grandchildren? Do you want to take up a new, like something, that hobby? Do you feel like you're going to be passionate about golf when you're 80? Well, guess what? You're not going to be golfing when you're 80 if you're in a nursing home staring out of a window.
Hmm.
And that's
Right.
exactly where you're going to be if you continue on this path. And once you get to what people's like true motivations are, like when they
Hmm.
when you kind of know what makes them tick, it's easier for us then to like really work in a pattern, a strategy for them, because we know what they're getting to. Because you said it before, you're not just seeing, like you might see like super high level athletes. They have a
Hmm.
very different thing than the 65-year-old that's like, you know what, I've lost my mobility because both my knees are bad and I've got my everything hurts and I have, rheumatoid arthritis now and all kinds of other things. It's a very
Hmm.
different, way. So that person just wants to maintain their mobility. So you're going to do that different than I want to win the Heisman Trophy. Those are completely different,
Yeah.
approaches, right?
Yeah.
As far as what we're considering.
Yeah, and I think when you were talking about like getting to know like what makes the person tick,
Mm-hmm.
right? Well, another word for that is their values.
Mm-hmm.
What
Yes.
are their values? And really tying that goal to their values. And because again, we're only going to do things that benefit us, that we are motivated to do. And a lot of those actions that we do are tied to our values, who we think we are, what we
Mm-hmm.
stand for, what we believe in. And a lot of people don't know their values or have values they think they should have. Based on all the stuff that's around us, our family, again, how we grew up, all of those influences that we have in our life. And I know even for me, like I'm constantly revisiting my values, like I just did. I just redid mine again, um, because I thought I had all of these like really great, like doing my vision board and all that stuff. Like, I had all these really great ideas. And then I sat back and I was like, what the fuck is this? Like, is this me? This isn't me. Like, I don't care about this. Like, I thought I did, but I really don't. And it's so eye-opening to really think about what do you value because your life currently really is a reflection of your values, of
Mm-hmm.
what you value. So if you're not liking what you're in right now, it's an absolute reflection of your values. You're valuing the things that you're putting your time, your energy, your money to. That's exactly what's showing up in your life. So when people are thinking about their goals and well, it's so when you and I are working with clients and we're trying to figure out, what is a good goal for them or this is what they say they want, but this is really what's the thing that they're after. So it's what their tick is, and
Yeah,
that's
what
not
their
what I mean.
ticket? Well, that's a whole different.
Wanted to say, but that's what it is. That's exactly what it is.
No, you're absolutely right. I think the other, real critical thing that I love to talk about with patients, once you get to know them, I mean, listen, my big tagline, which I took from my good friend Margaret, and I use it, it's all over my book, is this: becoming the CEO of your own health.
Hmm. Exactly.
And you know what that takes? People need to be accountable for themselves. I feel like in our society, we have become a
Hmm.
society of looking to others to make
Hmm.
decisions for us, and we have given up our sovereignty to
Hmm.
corporations, including food corporations, pharmaceutical companies, everybody that's trying to sell us everything, because we're all commoditized, right? Like all
Yeah.
day. And anybody that disputes me, pick up your phone, look at your spam, and tell me that you're not a commodity. Literally, everybody's
Hmm.
trying to sell you everything. For me,
Hmm.
because I do so much on LinkedIn, I was just laughing yesterday. Now that I just do so much more media, the amount of spam and people trying to sell me products and ideas, and they want to coach me and they wanted to
Hmm.
constantly. So, but we give up our sovereignty, but ultimately that's great, and we need to figure out who we use. Like, for example, if we wanted to use, like I wanted to use you and say, hey, I want you to really help me with it, it's still
Sure,
it's
choice.
my responsibility. We have to take like this self accountability, and you know what, when people take accountability, they're so much happier. One of the my
Hmm.
favorite sayings, I don't know if you follow Gary Vanderchuck. He's
Hmm. Yeah.
awesome. He's awesome, and he's also fun. He's also a big Jets fan. I'm a big Jets fan, so we have this huge connection. But when he says, he's like the happiest day in your life is the day that you realize that everything that happened to you is your fault.
Hmm.
Why? Because then we can do something about it. we can't
Yes.
we have that sense. I tell my kids that all the time. I'm like, you have to take accountability for yourself, the things you say, the things you do. It's no one else's fault. Like ultimately, yes, if you get hit by a bolt of lightning, it might be
Mhm.
your fault because you're in, you should know not to be out, in a wet field, like in the middle of a huge, but besides that, I'm just saying most things,
Mhm.
a lot of it is our own fault. How do you deal with accountability? Like, do you feel like it's a struggle to get people to really take accountability? Because even when they see you, they might be like,
Mhm.
okay, you tell me what to do, you write it all down, and I'll do
Mhm.
that. But they have to be the ones, guiding it. They're just hiring you to be that, to just be managing that part of their life. Like you're almost
Mhm.
like their manager in that department, as opposed to just they just taking their marching orders from us, right?
Yeah. And I think if somebody is really after true transformation, true
Yeah.
results, then they have to be accountable to themselves. Can nobody be accountable to you but you?
Yeah.
So, and I know for myself, that was really the huge catalyst that I had, that moment of truth, that moment of reckoning where the doctor was like, "Yo, don't ever think about getting pregnant again. Don't have another baby because if you do, you're
Yeah.
gonna die. Your baby's gonna die."
Oof.
I was like, what am I doing?" Like I'm 35. At that time, I was 35. Now I'm
Okay.
42. But at that time, I was 35. I said, "What am I doing with myself, with my life? Why did I bring myself to this point in my life?" And that was my moment that I had. That was my moment right there that I had. Um, and accountability is something that really, I think if somebody doesn't have a very much
Mm.
self-confidence, that they really lack a lot of accountability also because accountability kind of breeds self-confidence because you're
Yes.
holding yourself to
Mm.
your own word. Um, and when you just lie to yourself constantly and don't follow through with what you say you're going to follow through with, your body just kind of learns to not really trust. You don't trust, your body doesn't trust itself anymore.
Mm.
And this happens like psychologically, subconsciously. This is what keeps happening and why people always are going through the same cycles all the
Mhm.
time. And oh, I was doing good, but oh, this happened. Oh, I was doing good, and then this happened. Um, that's what really runs that pattern is that lack of accountability for yourself and
Mm.
that self-awareness that you have. That's not something that you can buy from anybody, honey. You
Right.
cannot buy that from nobody. That is something that is within you. And I think working with a skilled provider could bring that out in
Mm.
you. I've done that with clients. You've done that with clients. You can bring that out in somebody, but you can't be the patient and expect that somebody's going to give that accountability to you. Accountability is all within you.
Well, yeah, absolutely. So accountability. So you took accountability, and I know you struggled. What you just mentioned, that you just gave a little blurb of it. Can you
Mhm.
can you tell us, what was going on with your? How did you get to that point, like where you weren't well? Like seriously, like when you do
Yeah.
your real, evaluation of your life. I love the fact that you do
Hmm.
the boards. Sometimes, I've done that before, and I'm like, I don't know, what am I talking about? We know deep down in what we're. It's hard to sometimes it's hard to get it out of ourselves. We're sitting there, we're just writing
Yeah.
nonsense. Even when you make your resolutions. It's fun. I was on a
Yeah.
plane coming back, and somebody was like staring over. They're like, "You're making your resolutions." Like, yep. I had like a whole list. I was writing all these things. I'm not going to tell everybody what they are, and
Yeah.
if I've kept them or not. But it's pretty good. So anyway, how did you get to where you were? Like, how did you get there? Was it because there was just, you felt like things were just moving too fast in your life? It was just like whatever, or were you just in
Mhm.
complete denial like that, which is what a lot of people are in? You're just like, it should be fine. I'm young. I'll be fine.
So kind of what we kind of talked about in the beginning or what I was mentioning about how I was raised. So I'm Puerto Rican. That's my background. And I grew up in a family. I was raised in a family where, and I'm not exaggerating any of this. And if you're like Hispanic, you'll know you will know because you probably are living this right now. And this is why I share this story about myself is I grew up in a family family where every single person was type 2 diabetic,
Hmm.
on insulin, missing fingers, missing toes, missing below the knee amputations, like all of that mess. That was my entire childhood, giving insulin injections to my uncle when I was like 8 or 9 years old. And that shit was considered normal. That was my normal childhood growing up. When I think back of how much trauma I endured, I think people think trauma is like, oh, you got sexually abused or you got beat or oh, they starved you and blah, blah, blah. Trauma comes in so many different forms, and it wasn't until I was older where I realized how much trauma I had actually experienced growing up, being around illness, being around
Hmm.
sickness, being around low standards, honey, where this was considered normal. Like, it's normal for people to be missing fingers and toes, and that's just what was going to happen to you. And also being in a family where every single person was very obese, like
Hmm.
very obese. I'm not talking about like a little muffin top situation. I'm talking about like super, you know? And just people dying early ages. Even my dad passed away in his, or I think he was 52 when he had his first heart attack and stroke, and he was severely rehab, all of that stuff. Had to come live with me for a while because his wife divorced him in the nursing home because she didn't want to take care of him. So he came to live with me, and I had two little ones, a 1 year old and a 3 year old, and I'm in school full time. Okay. So having that happen, and then he had another stroke and heart attack, and it went to his brain, and he we had to take him off of life support because he was that far damaged. And so having all of those experiences in my life, like that was normal for me. So being overweight was normal for me. Taking medication, like being on medication, I was just kind of taught. And even though I had been in healthcare for like up now it's over 20 years, but I was just starting to kind of get into healthcare at that time, and I was a nurse aide and an LPN and an RN during kind of all of this. So I knew all this shit, like I was studying it, I was taking care of patients like that, but I didn't connect my lived experience, my trauma growing up and what it was doing to me physically. I didn't, maybe it was denial. I
Hmm.
just didn't register it at all. And so that really is what brought me to where I was, because that's what I thought a normal life was like, because that's what I experienced. And now I'm 42, almost 43. My birthday's in a couple days. Um, I have three children, 2017 and 7. And I wanted to make sure that they never have to experience giving mom a shot, having to see mom sick in the hospital, hospitalized, high blood sugar. Like, I wanted to make it a point that my kids were never going to have to see that type of illness, but know wellness growing up. Know what wellness looks like, what it sounds like, what it feels like, what it is to live that type of life. That's what I wanted my kids to experience. So my kids are having a whole different upbringing than mine. And I know all of our experiences are meant for a reason. We're meant to live through them. And that was my reason to be here with you today. That was my reason for experiencing all of that growing up. And now my kids are experiencing something entirely different that they're going to take with them to their children and beyond. So it's how perspective and how you look at it, but absolutely, my culture and my upbringing took me to where I was and where I am now. That's where I am now.
Well, certainly, thanks for sharing that story. We see that all the time. We talked before. My wife's family's Puerto Rican, so
Mm-hmm.
I don't want to divulge all their, but
Yes.
certainly there are plenty of people in that family that have no understanding, and you see it around. It's interesting. We were talking about that in general in certain populations, because it's just very different, depending on how you grow up. But I had this Bernard Tony. He was the White House officer through a couple of administrations. He's a PA. He's now a diplomat. It's great to know him. He was great. He was great on the podcast. But we were talking about, now he grew up in the DC area, inner
Mhm.
city DC area, and we were talking about like the African American population and their understand. I mean, he went on a complete rant about how like no, like nothing, because he's like, their idea is like it's normal to you just get diabetes, and when you get the
Mhm.
sugar, you get the sugar pill.
Yeah,
Then
that's
you get
it.
the sugar pill.
Mhm.
So he scares them. He had his tactics. He would just tell people, he's like, well, you know what? He's like, you like to walk? And they'd be like, yeah, I like to walk. He's like, well, how are you going to walk around if you have no legs? and they would just think for a little bit. He's like, and they're like, what do you mean? He's like, you're not
Mhm.
going to have any legs. That's what happens when you're going to be blind and all those things.
Mhm.
And so some culturally, some
Mhm.
cultures it's inborn. And I love the reference to trauma, because we always talk about generational trauma and the way it jumps.
Mhm.
And generational
Yeah.
trauma is actually real, and we could do it. There's
Mhm.
mice studies that show that basically
Yeah.
if you make a mouse like afraid, like shock them when they're having a cherry, and then you have
Mhm.
them pass the generation on and they never experience cherries, like down the road, that mouse that go, like you just put, they smell the cherry, they
Mhm.
get scared, they've never even experienced a
Yeah.
cherry, and they're down the road. And so
Mhm.
those things get imprinted into our genes. But then there's the other trauma where it's like physically you saw it, it was just like actual trauma, it's not even
Yeah.
generational, it's just there,
It's
right in
there.
front of you. And absolutely, your environment is so critical. And that's why I love to talk about this stuff with people, because honestly, if we can educate one of the members of the family, like let's say the
Mhm.
matriarch or the dad, whoever,
Yeah.
then that can that can turn around entire generations
Entire.
of entire just by having
Mhm.
a simple conversation in the
Mhm.
office, like, hey,
Mhm.
I know you don't know this, but here are the things that you can do to, to radically, change everything you're doing. Because in those cultures, nobody meditates, right? Nobody
Yeah.
does those things, deep breathing. Like these are like all biohacking. They have no idea what, right? They don't have a
Right.
clue what biohacking is. And that's everywhere. I see it all around. And that goes for rural
Mhm.
populations. And to be honest with you, I know you're a little I think you're a little gentler on the American. I really think there's a guy, Dr. Lustig, and he has a book, and it's called The Hacking of the American Mind. It's one of my favorite books. You should read it. And it's like how corporations have hijacked. It's,
Mhm.
to me, it's on purpose. Because to be honest with
Mhm.
you, when people continue to live these lifestyles, it's great for business. It's good for
Yes.
everybody. Everybody
Mhm.
wins, right? $4.4
Yeah.
trillion dollars. People love it. You get sick, right? And we have all these people that we can give all kinds of pharmaceuticals to. And,
Mhm.
they need beds in these places, in these places that we need to take care of them. The hospitals are nice and
Mhm.
full, and all these other things. So when you were, so you're sick, was, let me ask you a question. Was it like Eckhart Tolle, the New Awakening guy, I forgot what his other book was, but was it one of
Yeah.
those things where you were just on a park bench one day and you were just sitting there and you just said, I can't do this anymore? Like, did you just get so sick and tired of being sick and tired, or was it a gradual transformation? You just said, hey, let me try a little intermittent fasting, or let me do this. Or was it like suddenly you're just like, I'm done, I'm just going to take out my book and this is what I'm going to do, or find
Yeah.
somebody to help me?
Yeah, it definitely was that decide
Okay.
word, that
Okay.
decide moment. Yeah, it wasn't a let me try a little of this, let me do a little of that. Like it was a decide. Like I knew it was my moment. It was my time. And everybody has their time and
Mhm.
however they decide to do it. But I think deciding is and knowing what the word decide is not like, oh, let me think about it. Like that's not decide. Decide is there is no other option. Like you are doing it. You have decided.
Love
And
it.
then are you going to keep your word to yourself is another thing. But deciding was the biggest move that I made for myself was just deciding. And from there, it's action after action after action and being consistent with it. And that's all that it doesn't have to be super complicated at all. Because
Mhm.
again, we know
Oh,
the basic things that are going to get you there. We know the
oh,
basic things. It was just doing those
mm,
consistently. Um, and something that you were speaking about earlier, like with the whole generational things that we
mm,
just
mm,
kept
mhm,
perpetuating them, and
mm,
it only takes one person, right? Um, so much of that is, you know, why we perpetuate it is because nobody, and this is the work that we do, right? And so many other people, like we're actually teaching people how to take care of themselves. And
mhm,
when you don't have nobody to teach you to do that, then what hope is there for anybody if there's
mhm,
nobody there to teach you?
mhm,
And a lot of it with, like I do a lot of women's health. So for me, with the self-worth and the self-love
mhm.
and the thoughts and like just being filling your role and just don't cause a commotion. I grew up very in church, very religious, and that was the whole brain scramble. I was going to use another word, but that was a whole brain thing right there.
We could listen. We could talk. I grew up. I grew up in
Yeah,
hardcore Catholicism. We could share.
yeah.
We could do an episode about
I
that stuff.
mean,
That's a
yeah.
whole other
It just
interesting
it
thing. Yeah.
screws up your whole total thing, and then like the role in your family again and the culture, and it's like nobody's teaching people how to really care for themselves. And that it's okay, like you should. Don't depend on somebody to just give you a bunch of medicine to make shit go away, because it's not. It only evolves and changes and gets
Mhm.
worse, and you're on more medication, a different medication. Let's do an injection here. Let's do a pill here. Oh, we got this new thing over here. It's the ma maintenance of all of these illnesses that we have. That's what it is.
No, absolutely. So you were. So then, all right. So you started morphing. You started get. Was that when did you make the decision to transfer from like doing the hardcore nursing stuff, in the
Mhm.
hospital that you were doing? Like, was it
Mhm.
easy to make a decision saying, hey, you know what, I'm going to just do I'm going to do this consulting and work with clients individually and do your programs? I know
Mhm.
you have the 90-day program. We'll talk about that a little bit later, but
Mhm.
when did you make that decision? Or did you like, because I mean, I know people sometimes that just make it like a real clean decision. They have a couple bad shifts and they're like, you know what, I'm going to just go do this other thing because I'm really passionate about it. And you have one at bat in this life, as far as we know anyway, but, and then
Mhm.
they just go do it. Or was it something you've thought of for 2, 3 years and then made the decision, made the jump?
You know what? It kind of was a gradual process. I think it really hit me because I started my doctorate program right when the pandemic, like right before the pandemic hit. So it was a whole combination of that also. But I was getting just I really love teaching. So I'm a professor also, full time, a nursing professor also. So I was teaching and I really like teaching,
Mm,
and I was like, I really kind of want to transition out of the hospital and the bedside to, doing more of my thing and teaching. And it got to be where I started counting down the shifts, and I kind of knew that when I got to the end of my program for my doctorate that I was never gonna go back to a hospital type setting anymore. Like literally the hospital, walking into it was like killing. And I say this and people think it's super dramatic, but literally that's how I feel, or how I felt was
mm.
like little pieces of my soul dying every time I would be going up in that hospital, just seeing all the other healthcare workers walking in there. Like I felt like I was walking to my death, literally just dying every time I walked in there. And it just got very frustrating with the same patients, the frequent flyers all the time, dealing with the same thing. And then I remember there was one day that I worked in the cardiac ICU for a long time, and we had a lady who was like in her early 30s, very overweight, obviously not taking care of herself, but she had all the clothes, the bags, the nails, the hair, like she had all the phone, she had all the things. And I saw her, and I was working night shift, and I saw her really late at night FaceTiming her 1 year old
Oh,
and saying that, mommy might not see you tomorrow because I'm going to surgery. She was going to go get a heart cath in the morning, scheduled for. And she's like, mommy is going to have a procedure tomorrow and she might not see you tomorrow, after tomorrow. And just like the baby, like obviously is not
yeah.
understanding what she's saying, but I'm outside the room, like fucking like crying, hearing her say this stuff. I was like, oh my God, like, what are we doing? Like, what is she doing? Like, I wanted to go like smack her, shake her, be like, girl, you can reverse this,
Mhm.
like we can do
Yes,
something.
yes.
And but then I know I couldn't say, then that was the other part. There was so much that I wanted to say to patients that I knew I could not say because I would get fired, the hospital would get dinged for it, my manager would be calling me, like it would be over, done with. Like I think the way that a lot of healthcare workers feel this way, but we're like suppressed because you can't talk negatively about anything, and you got to have the image and you got to say things a certain way, and we're here to take care of people, and it's like none of that is helping anybody. It's not really helping the healthcare system at all.
Mm-mm.
And I just couldn't bite my tongue anymore. I couldn't do it again. I felt like a piece of my soul was dying every time I was going up in there. So when it was my last day for my contract, I was done, and
That's
that
and
was
it,
it. And I said, I'm never going back. And I never have.
Well, I mean, and you know what? It's really difficult to see it. Honestly, that's what
Mhm.
spurred me into doing what I'm doing. I was perfectly happy, doing my spine surgery thing and, doing
Mhm.
my business as usual. But every single time I would hear these heartbreak. I mean, honestly, I'm sitting there in my clinics like heartbroken because
Yeah.
I just look at people or I would look at like couples that don't even want to talk to each other. You know why? They're sick. They're not well. They don't feel good, or people coming in with these crazy ulcers. I'm like, well, we're going to do surgery, and then we undress them, and then like they got this big foot. I'm like, what are you doing? Like, why
Yeah.
what's going on? So then really started getting into the kind of integrated, and then eventually I just made that decision. I'm going to start a podcast. I'm going to do this because
Yes.
I need to express these things. Now, the
Hmm.
nice thing is in the clinic
Yeah.
setting, I express it. I do. I mean, I'm notorious. Sometimes I get so like the people come in. I've told this story before. People that watch my podcast, they're like, man, you're such a repeater, but it's fun. But anyway, like they come in like with the big gulps.
Uh-huh.
It's eight
Oh,
o'clock in the morning.
what are you
So
doing?
I don't even, you know what? I'm past the point. I can't. I'm like, listen, I'm going to talk to you about your spine. I'm going to be really clear with you. What is this? What are you
Yeah.
doing? This is
Yeah.
insane. I'm like, that's
Hmm.
like a bucket of sugar that you're drinking.
Yeah.
It's not even, it's eight
Hmm.
o'clock in the morning. You're my first patient today. And
Yeah.
then we just get into how that damages your body and blah, blah, blah. But anyway,
Hmm.
I'm done holding it back. And I love the fact that you say that you felt constrained. Obviously, you're not constrained in your position now. You can just tell people like it is.
Ooh, I'm loose.
But I was just talking to one of my partners the other day. My partners now that are around me, all I talk about is, I'm talking about my like surgical partners. They're
Hmm.
always hearing me talk about health and wellness, health and wellness. And, I
Hmm.
drag them into the clinics and we're just kind of force them to do stuff, but themselves. But one of my partners was saying how he is afraid, and many doctors are afraid to really start talking to people about their obesity
Yeah.
because he doesn't want because then you get the negative reviews and it gets
Hmm.
around and I just tried. I said, listen, I've been doing it now for a long time, very honest, but if you come from a very caring, if you just say I'm doing
Hmm.
this because I care, not because
Hmm.
I'm not judging you, I'm not doing anything. I just want to have a conversation because I want you to live a productive well
Yes.
life where you're
Hmm.
happy to get up in the morning, you have goals and dreams, and you're not losing your mobility and your ability thing or the ability to breathe. Or how about the COPDers that then go outside in the parking lot and they smoke and we like open the window and start yelling at them out the window like, hey, what do you
Hmm.
do? Like, what are you
Yeah.
doing? Why are you
Yeah.
doing that? So no, yeah, that's awesome because we do hear that and it's true. And you guys as nurses, and I love nurses and respect so much what's done, but you are there in ground zero. And the truth
Mhm.
is, you probably people would take it the wrong way, potentially, right,
Mhm.
in that setting, but they need to hear it more than they
Mhm.
need anything else. That you just saying to that one lady, you can't. This is not like, what are you doing? Like
Yeah.
they need that because if they do that whole hospitalization and no one tells
Mhm.
them that this is not normal. This is not
Yes.
normal. This is not like, yes, you're in the ICU and there's a lot of sick people, but it's not normal.
It's
This
not
is not a
normal.
normal thing.
Hmm.
So, very frustrated. So thanks for sharing that.
Yeah.
That's great. Do you miss the hospital at all after the experience of feeling like you're gonna
Hell no.
like no,
Hell no.
okay. But honest,
Hell no.
it's good.
I do not
We
miss nothing.
we have honest conversations here. And listen,
Yeah.
it I see that. Do you think so? Let me ask you a question because there's
Yeah.
different reasons for that. What I'm hearing is
Hmm.
that you were in the same boat as many nurses are and
Hmm.
physicians,
Yeah.
burnt out to a crisp.
Hmm.
You probably like
Yeah.
had cortisol dysregulation all over the place and all that. Maybe you didn't because you're into that, but people get really
Yeah.
burnt out, like really burnt out in
Yeah.
health.
I was gonna say I saved myself before I got
Okay,
there. Yeah. I would have to say I was very frustrated, but I wasn't to a point where I was burnt out where that was affecting my health. It was
okay.
other things that were
Other things.
affecting my health, but not so much as that because I had already processed a lot of that and was like I know that this is not healthy and a lot of the things that we and do to people are not healthy. And I really feel like every healthcare worker should be in therapy. Like for real. Like I have a therapist, but every person in healthcare should be in therapy because this is like what I teach my students now too. I tell them like you're gonna see a lot of fucked up stuff here. We do a lot of horrible things to people. You're gonna hurt people, like we're putting IVs, tubes in people, up their nose, in other parts of their body. Like we're doing painful things to people. And it's not normal stuff. You see people die. You do CPR on people, and,
Mhm.
and maybe they die. You might work in the NICU and have a baby pass away, or work in L&D and mom might deliver a stillborn. Like there's a lot of stuff you're going to see and experience that is going to become normalized because of your profession, but it's not normal for any human to be experiencing and to just be like, oh, let me go about my day and not expect to be affected by it in
Mhm.
some way. So I really stressed that whole mental health part of it, but I was really taking care of myself. When I got to that point, I had done a lot of work on myself at that
Okay.
point. And so I was avoiding that whole burnt out piece. But boy, yeah, I see it and it's awful. It's a lot why a lot of us leave
Well,
for sure.
to be honest with you, it's probably because you were taking care of yourself. Potentially, it's why you were able to make a very rational decision to
Yeah.
do something else, to do your teaching, teach
Hmm.
the students, and also,
Yeah.
do this the project of helping people individually. Because I talk about burnout a lot, talk about it in the
Hmm.
book, and I see some of my colleagues that are so burnt out
Hmm.
it's like they're corpses. They're corpses. They're
Yeah.
shadows of their former self. Like they're apathetic. They're just sitting there. They're going through the motions. Some are
Yeah.
just gone because they have to make a living. They went to med school,
Hmm.
so they might as well continue doing it. But their level of joy that is associated
Yeah.
with the practice of medicine has really been evaporated. For me, it's the opposite. Now that I look at things, our favorite word that we talked about before, I mean, I look at things holistically.
Hmm.
I have more energy and more passion. I actually enjoy even like the spine surgery more because I'm not just focusing on reconstructing their spine or doing whatever we need to do, but I'm also trying to build them up as a human being, their body. I have all these conversations about mental health and spiritual health and all these other things. And I would say, like, most people are pretty surprised when they meet me for the first time and they just think they get a referral to the spine surgeon,
Uh-huh.
and then we're talking about, like just really we go down all kinds of paths, and it could turn into a therapy session. It could be this or that, because to be honest with you, a lot of people that come see me, the spine condition, it's the least of their
It's
worries. They're just
totally.
perseverating on that. Oh, my back hurts.
Hmm. Hmm.
I know that's what you're saying, but is it because
Hmm.
the rest of your life is broken and we need to think about, like,
Hmm.
what are the things that we do there? Okay. Now let's dive into how you're making people better, because obviously now
Hmm.
people get, if they listen to this point, hopefully they did, because I'm having a great time talking to you. So, it's like, now, so how to help people. So as far as the practice itself, now would you like to use more the word, because it's a little different technically. We don't have to get into the technicalities. Would you
Hmm.
consider yourself more like a functional medicine specialist, integrative health? Like what are your, like, what do you use? I mean, there is a specific track for functional medicine where you have the six
Yeah.
buckets, and it takes a long time, by the way, to do, like,
Yeah.
for us as doctors, like, to do functional medicine, it's like
Hmm.
a very, very long but it doesn't matter. It's an idea, right? And then integrative health,
Yeah.
to me, is more bringing in a lot of the biohacking stuff. So I call myself
Hmm.
more of an integrative health specialist on the other side. So how do you like to kind of categorize yourself?
I've kind of just went the phrase with the phrase holistic biohacking. That's really the phrase that I've been using lately. And I just, because it's a mixture of all those different things of integrative medicine, of functional medicine, getting to the root cause and doing things very naturally, getting your body to work with, you work with your body instead of against your body.
Mm-hmm.
But I think for me, what really I'm passionate about, and some of the stuff that I spoke about earlier, is really like
Mm-hmm.
the whole metabolic health, like
Yes.
metabolism. Um, and hormones, and not just like, oh, my estrogen and my
Oh, yeah,
progesterone.
exactly.
Like I'm talking about like insulin and really looking at the whole underlying like metabolic health and dysfunction of so many people, and
Mhm.
that's driving so many other health conditions that they have. Um, and then for me, I'm 42, and I I have a lot of women that are around my age that are following me, and so I really talk a lot about the hormonal changes that we're experiencing
Mhm.
in our lives. And there's a lot of women, not that I'm having any more kids anytime soon, like I'm not, but there's a lot of women who are waiting later on in
Oh,
life
absolutely.
to have kids, and our hormones have changed and at that point. And so some of my ladies come to me because they are trying to conceive. It's not
Mhm.
that they're dealing with menopause, it's that they're trying to conceive now later on in life. So, but again, it's that whole thing about like, let's get your body working and running and humming in the most efficient, optimal way possible. So that way, if you are needing fertility treatments or if you are needing hormone therapy or whatever it might be, like it's going to work so much better when your body is in better shape to receive it. So, getting people's bodies back into that type of situation and looking really metabolically at it is where I get all excited about that.
No, I mean it's really exciting because it's really the core of a lot of the things that we're doing. I say the word metabolic all the time. People's metabolic health, they're so sick. When we talk about
Hmm.
chronic disease, it's a metabolic dysfunction, right? They're not
The
well.
dysfunction.
It's funny. I've been talking about, I mean, I remember back as a resident, I would talk about, and here's a syndrome I see as a resident. Right now, I
Hmm.
see it different. But when I was a resident and I would see women, let's say late 30s to like 50s,
Hmm.
they would come in and we just evaluate that. That was when I was doing my orthopedic surgery residency. They just generally didn't feel that well. They had some skin stuff going on, but the big thing was they were swollen. So they were kind
Hmm.
of puffy, and they came with this diagnosis of fibromyalgia. So I was like, we're just taking care of their knee arthritis or whatever, right? As an orthopedic.
Yeah.
But I always would say, I always had a thing. I always would tell my co-residents, I'm like, I don't know what the syndrome is, but it's like a thing. And
Hmm.
it's constant. And we see that. And that's literally the very definition of
Hmm.
metabolic dysfunction. And we see it
Hmm.
all the time. And in my 20 years of practice, when you talk about metabolic dysfunction, we're going to talk about what's under that hood in a second.
Hmm.
What I've noticed more and more is when I walk into rooms, it the people are not well.
No.
They're not well. They're sick. And
Hmm.
they're not sick like in the traditional sense, but they're just not well. And it's not just the obesity, but it's the skin, the way their skin looks. They're swollen. Some of them have like very low grade pedal edema.
Hmm.
They're not well. And that's the first thing. Then I go and I see, oh, your blood pressure is 190 over 150.
Oh,
That's not good. We may need to send you to the emergency room today because I'm a
yeah.
spine surgeon and we're not going to do this here
Now we're not
in
doing
this
nothing.
clinic. You got to go somewhere else because we don't want you to
Yeah.
stroke out or anything like. Sometimes they're just
Yeah.
nervous, so we retake it. Obviously, that kind of stuff. But this metabolic dysfunction. So let's just. So if I come, I just say, hey, you know what? I want Dr. Rosa to help me out because I'm just not feeling well. I want to get what
Hmm.
do you test? For just a person coming off the street. I know it's different. We can get. I want to get into the
Hmm.
women's health thing because that's something that's so important and so missed. But as far as a regular person comes in and they just say, you know what, I want to, function at my best. Like, what are your go-tos as far as your panels that you're sending people out
Hmm.
for labs? And can you just talk about like why they're so important to get those as the baseline for folks?
Sure. Yeah, so that is one thing that I really love doing is running really detailed lab
Yep.
work on people when they come in. And because it's numbers, it's data. Like the numbers don't lie, the blood doesn't
Right.
lie, right? So I'm always looking at things like A1C. I'm looking at like inflammatory markers like a CRP. I run like the basic labs like a
Yeah.
CBC, CMP, stuff like that. Occasionally I'll look at some hormone stuff, but it just depends. If I'm doing stuff with hormones, I tend to treat to the symptom first
Hmm.
and not really kind of worry so much about the labs. It's more of like quality of life and how you're feeling. And we kind of do that, but let's look at the basic blood work first. I'm trying to think of some other ones off the top of my head that I run. Something else that I really love to do is, oh, and obviously cholesterol.
Yeah,
Heart
yeah,
health
yeah.
is a big one. So looking at the lipid profile, liver, kidney, looking at all those.
Yep.
Um, I like to do micronutrient testing.
Hmm.
So, looking at all the different vitamins, minerals, electrolytes, all the little pieces and
Yep.
parts. I like to look at that. I like to do food allergy, sensitivity, and tolerance testing also.
Hmm. Hmm.
Um, and I like the micronutrient testing because many people are nutritionally deficient. Um, Mostly everybody is to some capacity. So I like doing the micronutrient testing because so many people love to supplement with all kinds of things because they want to be fancy and they think that supplements are going to solve their problem.
Hmm.
And so I like looking at that and finding where people's gaps are, where they're not optimal. And again, we kind of talked about lab values earlier. Like most people just like the normal stuff is not in a good place to be. It's not a good place to be. So looking at where all the gaps are and then using supplementation, but different types, like what might be the right route for you. Is it going to be oral, a liquid, a patch, a cream, a powder? Like what will be best for you based on kind of like your health history? Because some people have different things that are going on, but filling in all those gaps and supplementing a person exactly where they need it. Um, is a really great way to kind of just overall help them to feel better and to alleviate a lot of those other issues that they have. So I like to look at the data. I love A1C. And then the other thing that I like to use is a continuous glucose monitor. I
Hmm.
use that
Yes.
in my 90-day programs at the minimum of 90 days. You're going to be rocking a CGM
Mm.
to see what's going on with your blood sugar and are you on the high side? Are you on the low side? And then, if you're on the higher side, we can do some intermittent fastings, like some longer windows might be better for you. But if you're on the lower side, maybe some shorter times or more frequent eating times during the day might be better for you. So it just depends. But there's different ways to work with your body, again, not against it. And one size definitely does not
Yeah.
fit all. So running some of these labs can really pinpoint where your body is at and then retesting at like regular intervals. Like just don't like get it done once. Go
Yes.
back and retest and see like every 3 months, every 6 months, see what's going on and see how you're progressing. Because as we age, the whole lining of our digestive system changes. So we're not absorbing, digesting, metabolizing the same at 40 that we were at 20. So you can't expect to do the same stuff and see the same results. So it allows you to kind of really readjust, to adjust and customize what you're doing for yourself because you have so much power over that.
Hmm.
So use this knowledge to your benefit and really customize things for you. Just don't go by what everybody else is telling you.
No, I love what you said about the not one size fits all. A lot of it is really an experiment, and then people do that, and
Hmm.
so sometimes I'd post more specific stuff on a specific nutrient or something like that. I don't do
Hmm.
that a lot because I try to stay broad because otherwise
Yeah.
I'm just like just come see me if you want to really get into
Hmm.
something. But
Yeah.
it's a lot of testing, it's a lot of self-testing, and so I do a lot of myself. I'm not like like Brian Johnson, like the guy that wants to
Yeah.
live forever. That guy, I follow him, he's awesome. I'd love to get him on my podcast, actually. It's so fascinating, what he puts himself through. It's crazy.
Hmm.
But the interesting thing is we have to experiment on ourselves, and so
Yes.
I perform self-experiment. So like, not to get, but it's very specific. So I've tried almost every single diet.
Hmm.
Joel Furman tried to get me to be like do the whole vegan thing. I tried it for about 3 days. That's not my thing. I at least have to do like pescatarian or whatever, but I just
Uh-huh.
can't do that. Intermittent fasting is my big go-to. I talk about it all the time. I know that you're big on it, but it's about
Yeah.
like you really have to just experiment, and everyone's different because as you know,
Hmm.
even with like the hormonal stuff, there are people that you can put them, even women, you give them a touch of testosterone or you fix, some of their other hormones. Same thing in men. In some men, you put them on testosterone replacement and they literally wake up like Robert De Niro in the movie Awakenings, like as if, they're frozen. And then all of a sudden they're like, oh my God, I'm alive. And
I'm
other men,
alive. Yeah.
they'll have a testosterone level of 200. You get them up to 800, nothing, no change, because there's
Hmm.
something else going on. They're exposed to
Yes.
toxins. They're whatever. There's some
Hmm.
other, thing that may be, but so really playing around with them, but them being the
Hmm.
active participant and then really wanting
Right.
to know. And then it's like the continuous glucose monitor. I like that, the way that you do it, because then you decide exactly how, whether shorter feeding windows and all that other stuff. And I see that because we were talking about like the social media thing. we,
Yeah.
we could we could we will we could keep that private, like what the stuff we were saying. But the
Yeah.
but the truth is like people are like, oh, if you take this one thing, or oh, if you do this, you're gonna, all
Hmm.
your dreams are gonna come true. It's not like that. It's like
Hmm.
everybody is so different, but that's what makes medicine so beautiful, is that everybody's different. Like I'm going to do
Yeah.
the snowflake thing. But like we're all different. Yeah, it's weird. People
Yeah.
like saying, I don't want people to make
Yeah.
fun of me with the snow, but it's true. We're all
No.
different. Everybody comes different. People have different metabolisms. They
Hmm.
process things differently. No different than when we send out people for genetic testing, because some people,
Yeah.
they can't process. So for example,
Yeah.
those patients that you give them
Hmm.
morphine and it does nothing,
Right.
and then
Yep.
everybody's saying, oh my god, they're drug addicts. No, they can't.
No,
They're
it
not
doesn't
getting,
work.
they're not uptaking. There's no uptake, and so they're literally, you're not even treating their pain, and you just
Hmm.
fix their broken spine, and they're not
Yeah.
getting pain medicine. So and then it's
It's crazy.
everybody's, it's pretty much crazy. What do you think about, I don't know if, are you familiar, Dr. Hyman's has his whole, like, Mark Hyman,
Hmm.
he has that whole battery. I mean, that thing is insane. Like, it's a
Hmm.
hundreds of tests of biomarkers
Yeah.
and genetic testing. And then so one of the criticisms on those hardcore functional medicine guys, I'm not a
Hmm.
critic. I like it because, yes, I agree. But they say anyway, they say that you get all this information. Now, what do like, okay, you have
Hmm.
a million labs. Like, what are you going to do with all that stuff? So I know you're going
Yeah.
a little bit, more. I think there's an in between. So do you think that that's completely overkill? Because his thing has,
Mm.
like, you're testing for everything, or it's just different. It's just different in different people's hands, because not everybody needs a panel of 100 plus labs and
Correct.
genetic testing and how they methylate their, every
Yeah.
vitamin that they take in. That's a lot.
Yeah. I think there's a couple layers to what you were
Yeah,
just talking about, but I
yeah,
do agree. I mean, I feel like every provider is going to have the
yeah.
way that they want to do
Yes,
something,
of
right?
course.
And
Yeah.
they're going to do it. And but I think what was coming to my mind when you were kind of speaking about all of that, like with all the different things out there, it
Mhm.
was making me, and then our conversation about
Yeah.
social media was
Yeah.
making me think about ChatGPT
Mm,
and how everybody's using AI to search up their test results, search up their
yeah.
supplements, search up their lab, I might have said lab results, but like their diagnosis,
Mm,
like the information is there, but I think what is the beautiful thing about health, about medicine, about wellness is that there's really an art to it. There's a
yes.
nuance to it. And that's where the whole expertise comes in from people like you and I and those other doctors that are running all the tests. And there's such a nuance there in how to apply it to somebody's life.
Right.
So just like you said, like somebody can get hundreds and hundreds of test results and it's like, oh great, now I have all this
Yeah.
information. What am I going to do with it? And that's where having somebody, that's where we will never go out of business, honey, with no matter what ChatGPT and stuff comes up, because there is so much nuance to the art that we do, to the knowledge that we have, and how we apply it to people's lives. So I think that's a big thing that people are kind of missing right now in because you see it, I see it
No,
every day. Like people typing in their test results. I mean, these people listen to my biggest pet peeve right now.
I'm
When
listening.
people like copy and paste their test results and put them into groups for
Oh,
people to like tell them what do you think is wrong with me? My doctor said this, but what do you guys think? To like some rando group of like 30,000 people, you are gonna ask that. Or they screenshot their ChatGPT thing that they typed in and asking for what do people think about it? And I'm like, this is where people are going so wrong And it drives me crazy when I see it. That's like my biggest thing right now. That gets me going. But there's that nuance, there's that art behind it. That all of this information is great, all this technology is great, but even with all this that we have, people are still getting sicker and sicker and sicker. Even with all this amazing technology that we got going on, we still got all these problems. So something is missing, and we ain't gonna find it in ChatGPT.
You're absolutely, right. I actually had the author of the book ChatGPT, MD, who on my podcast, who
Oh
actually
my God.
90% of the book was written by ChatGPT. He said he wrote
Uh-huh.
I think he did one chapter, by himself. But you're absolutely
Mm-hmm.
right. It's a tool,
Mm-hmm.
and I just loving the way the thing is. It's I talk about all the time. It's a feel. It's like
Mm-hmm.
the best
Yep.
providers can just feel like it's a feel
Mm-hmm.
that these computers or whoever it is doesn't have. It's not like, yeah, there's algorithms that we have for certain, there's all kinds of stuff you can have, but you can just feel like when somebody's kind of slipping, whatever. And I think that
Mm-hmm.
AI can definitely help us. So he was
Mm-hmm.
talking about how in his hospital he was the CEO of Kaiser Permanente, I don't know, for like 19 years or something. Like, he basically saved that hospital. But when they brought in
Mm-hmm.
AI, by looking at people's labs and what was being put in, because obviously AI only knows what the inputs are, right? And they're whatever,
Mm-hmm.
they were able to know when people were at risk to need to be transferred to the ICU, which saved them a lot of
Uh-huh.
money. And I know like Cleveland
Yeah.
Clinic now has a big, thing with Palantir. So I think AI, you're absolutely right, as a tool, but I don't think it's going to replace that feel of medicine, because you
Mm-hmm.
can't. Not just that, but AI also can't replace that human bond that we have with each other. Because
Mm-hmm.
honestly, like even talking to you, like I'm having this conversation, I'm very relaxed. This is therapeutic for me, having this
Mm-hmm.
conversation. We're just having a conversation. I feel better. My blood pressure, is probably better than it was before we
Yeah.
started. I had a lot going on today, but anyway, my blood pressure's down. I feel good. So it's almost
Mm-hmm.
like I'm getting some therapy just by doing that. I love my podcast because it really is therapy for me. I love talking to
It's cool.
people. It's
Yeah.
it's awesome, but it's really that feel. I want to talk about women's. I know how passionate you are because you talk about this, like women's medicine. Before I launched into this whole other path, which 5 years ago I would have never thought I was going to be doing what I'm doing now. Um,
Yeah.
but the women's health thing, it's a pet peeve. So now that I get to speak to a lot of women about their health, now I don't. So we have a nurse practitioner who does the women's health in our clinic. I get to meet these people and I talk to them. I hear this, stories.
Mm-hmm.
Why in 2025? Okay. You want to talk? We could do pet peeves all day. I know you did one of your pet peeves. I could give you about 30, but
Uh-huh.
why in 2025? I'm getting into men's health too, but in
Yeah.
2025, why do women go to their primary care, whoever they're seeing, and get completely blown off when something is clearly either they have like some cortisol, dysregulation or
Mm-hmm.
whatever, or they have an issue, a hormonal issue, whatever. They're like, oh, you have depression, take this SSRI. Why?
Mm-hmm.
Let me ask you, because you're at the forefront of this. Why is this happening? It is, and I know that I see these like stars, right? Like the women, like the actresses go out and they're like, oh, women are,
Yeah.
they're, but, and sometimes that stuff is, I'm not big into the whole like celebrity thing, but the truth is
Mm-hmm.
it's real. It's real. They
Mm-hmm.
get so, these women, this perimenopausal period is
Mm-hmm.
so difficult for women, and they get in so many, and they get completely blown off.
Yeah, that's something I think about too. It's like people sometimes don't care about stuff until like a celebrity starts talking
Yes.
about it, and then it's like, oh my God, because I know Oprah shared like her experience, and I
Oh.
think I did like a reel or something about it where she shared her story because she was having like heart palpitations and stuff, and they were working her up for cardiac, and it was just her hormones.
Yeah.
And I was like, if this shit could happen to Oprah, like Oprah, but like
Oprah.
think about what's happening to like whoever, you know? But besides that, it's like so many different things, but like the biggest things that I see and that I feel and that I've experienced like firsthand is, you know, a traditional doctor's offices, traditional medicine, mainstream medicine, these are all phrases that I use all the time. Um, it's not set up to have those deeper conversations with
Yes.
people. And you got like 15 minutes to be in and out. Or you wait for an hour to see somebody and then they're in and out like as fast as possible on top of that. So there's just not enough time to go deeper into that. And that's a whole missing part of it. And again,
Yes.
people are not like augmenting their physical health with like mental wellness
Mm-hmm.
at all. And that's a huge whole nother conversation, but that's another piece that's missing to it. Um, and that there's not really a lot of training that
Yes.
goes in for when people are going through medical school or through nursing school or whatever type of health school that you're going through education, there's not a lot spent on anything with women's health specifically.
Listen, if the spine surgeon's picking up that somebody probably has like, PCOS or something, polycystic, because
Mhm.
they
Yeah.
clearly have it, that's bad.
Yeah.
Sorry.
Hmm.
That's not good. We're not in a good place. Sorry to jump in.
No, no, no.
It's a pet peeve. The things that I see miss now. I wasn't looking for them. It's like right when you
Hmm.
say somebody says blue car to you, all of a sudden you see all the blue cars, and
Blue
so now I
cars.
see all these people that are sick, and I'm just
Yeah.
picking up the stuff. And it's funny because I sit in my office when I'm in my spine surgery office, and I start complaining to the patients after I've talked to them. I'm like, why am I talking to you about managing your hypertension better? And
Hmm.
you're like, I don't understand. Is this where we've
Hmm.
come? Where I'm counseling you now on your high? Like,
Hmm.
who is managing these things? They
Yeah.
don't have time. They're just. And again, I
Hmm.
don't. I always want to be crystal clear. I love my fellow doctors and stuff. I'm not
Hmm.
here to whatever
Yeah.
people they've dedicated a lot of their lives. Nurses have dedicated their lives, but you're absolutely right. In traditional medicine, we
Hmm.
have lost that connection with people where we're just writing a script and sending them
Hmm.
out the door. And sometimes it doesn't
Yeah.
even make sense. And going back to the baggies with the patients,
Yeah.
this happens all the time. It's like a little game I like to play when they come with their bag. Some of
Yeah.
them, the cool thing is when they come with the bag, but they know their pills by the color because they just mix
Yeah.
them. And it's
Yeah.
like it's
It's
M&Ms.
crazy.
It's literally it's
It,
M&Ms. So
I
they
know
come
exactly
in
what you
and
mean.
they're like, I take the yellow pill at a 10, and then I take these two pills, and then and then the little white one, that's for my pick. And then I start asking them, well, why are you on this? And why are you on nothing?
Hmm.
And then they
Yeah.
confuse. Like I just had a patient the other day that was trying to tell me that their cholesterol medicine, right, was for something completely different. They're like,
Hmm.
oh, this is for my autoimmune. And there was another. This is all just like my clinic yesterday. And there was another
Yeah.
patient that was on a medicine for gout. And I kept asking them. They're like, oh no, this is for my blood pressure. I'm like, no, that's a gout medicine. I'm pretty.
Yeah.
And we were going into it, and I was like, do you have gout? And then I started. I don't even know if they have gout because I couldn't figure out if they had gout or not. I'm like, why are you on
Hmm.
this medicine? This is like a pretty serious drug. This isn't like not a minor like little thing, and they couldn't figure it out.
Yeah.
And so that's how lost people are. So that goes. So I digress. Back to women's
Yeah,
health.
that's
Yes,
funny because that
yeah,
was making me think about an
yeah,
incident that I had when I was teaching a couple of days ago. We were giving this one patient her medication, and one of her medications was like Paxil or Prozac
yes.
or Wellbutrin, one of those. And the lady was like, she literally looked at us like in the middle of her hospitalization, right? Just looks at us and says, I probably don't need to take this. The doctor prescribed it 10 years ago when my husband died. I
Oh,
probably don't need to be on it anymore. And I'm like, are you for real? Like, what is happening? And so it turned into like a great teaching moment with my
a
student
great
later
moment.
on.
Great
But
moment.
that's the
Yeah.
shit you see all the time. And like, this was making me think of like polypharmacy.
Yes.
People being on for people that don't know what polypharmacy is, being on multiple medications, just a lot of medication, a lot of pharmacy, basically. Um, you know, oh my God, I feel like I lost my train of thought when I was going to talk about polypharmacy. Oh shoot. Oh my God, I had a really great point I
Well,
was
you
going to
know
make
what?
and I
You know
totally
what?
lost my brain with polypharmacy.
The polypharmacy thing. It's completely out of control.
Hmm.
You know, there
Yeah.
are, like way over half of our population has a couple chronic diseases at this point.
Right.
They're on all kinds of they're all on all kinds of medications, and it's a big pet peeve. But and again, I just want to stress, even though we're both
Mhm.
healthcare providers, anything we talk about here, this is not meant for medical advice. I'm not telling anyone to
Correct.
stop your medications. You have to work with your thing, but
Mhm.
you should be asking the question, excuse me, I don't care if the person's rushed or not. Excuse me. Why don't we sit down? I'm on 10 meds.
Mhm.
I need to know why I'm on these and tell me
Yes.
why. Tell me why and give me the justification, because otherwise it's a mess. I do that all the time. I'm telling you, it's my scribes know. They love, like, I have all these young scribes that are, pre-med students, and they love
Yeah.
it. They're like, here we go again with the asking the medical, because I love that. I just like want to know. They
Yeah.
don't even know why they're on, why it started, whatever. You get
Yeah.
your thought back. Yes.
I did. I got
Okay.
my
Perfect.
thought
I
back
know. I know. I told you.
because
All we have to do
that's
is
where
I
I
just have
was
to
gonna
rejoin.
go. That's where I was going to go with it because I was going to say that, like, in my practice, I actually do not prescribe medication. If somebody needs something, I have my connections where I'll get them hooked up with it. But for me personally, I don't prescribe any medications. But what I do tell people is that I'm not against medication. Like, I'm not against medications. Like, some people, like, legit need medications for certain things.
Yes.
Like, you do need a medication. Like, so I don't want to knock that.
Right.
But what I do have issue with is polypharmacy. So like a lot of people that come to work with me, they do want to come off of some of their medications. And so the goal, or like a good goal, or something that I tell people to think about, it going with what you were saying, is, do I really need to be on all of these medications? And if I do, can we go down on some of the doses of some of
Hmm.
these medications? Like, what's the lowest dose where I can have the maximum best effect of this
Yes.
medication,
Yes.
but be on the lowest dose of it? So that's a lot of, like, again, that nuanced type of work that we can do with people to make sure that their quality of life, that the outcome, the result is what they want, but that it's also being balanced with, do they really need to be on all of these medications? Are they necessary? Can we cut back on some of them? Can we do something different instead of that? So that's really a great thing to think about when it
Mm.
comes, like, if you're somebody listening, and again, we're not prescribing, we're not telling you to get off your medications,
Right.
just
Yep.
informational. I say the same thing during my podcast too, honey. I'm like, this is informational only. But this is just something to think about if you are finding yourself on a lot of medication or being put on, or, you go to the doctor and they're like, "Oh, just take this and take this and this and this." And I'm like, oh my God, what's
Uh,
happening?
uh,
So,
no, that's no. Listen, we gotta. I like to be real with people. Like, this
hmm.
is serious conversation. Okay, and
Yeah.
this goes to my medical. Like, okay, statins.
Tell
Why?
me. Mm,
Why?
mm,
This is a big this thing in here, like in this,
mhm.
it needs lots of cholesterol. So why are we
Yeah.
overstating? You mentioned like cholesterol panels. What we do is we do
Hmm.
like these advanced panels, because to me, you got to really look at these apolipoproteins. It's just
Yeah.
it's better.
Hmm.
And I had this guy, Dr. Stephen McConnell, on, brilliant, just a brilliant scientist, and he really educated me on the use of niacin for a
Mm,
lot of these
hmm.
things. It's really a fascinating. If you get a chance, you
Yeah.
should watch that one, because he's like a brilliant, and he's very well published, like really interesting stuff on
Hmm.
something that costs like cents for a pill.
Yeah.
Niacin, it's just a vitamin,
It's
right?
incredible.
So
Hmm.
and it can, yeah, there's a little flushing. We all learn that, but that's not a big
Hmm.
deal if it can lower your blood pressure. I have had, again, not medical advice. I can tell you that I always ask them about that. And a lot of people, the time that they went from being robust and vibrant was
Hmm.
right before they started their statin.
Yeah.
And the statin
They
can do
they
all
mess
kinds
people
of stuff.
up. They
Messes.
mess people up.
And this,
They do.
it's not good for this. People, like,
Mhm.
okay, without even I don't want to get deep into it, but look what statins can do to some cognitive things, and how it
Mhm.
can be associated with some other stuff you don't want. So we
Yeah.
got the statin problem, SSRIs
Yeah.
for depression. And like,
Hmm.
listen, again, I understand people are depressed and they need medications, and I would leave that up to the guys that are, that
Hmm.
prescribing medication and their psychiatrists or their family doctors, whoever's giving them the SSRI. But you got to really understand that there's major side effects from SSRIs, major.
Hmm.
Isn't that
Yeah.
this is like minor? And when I say major,
Hmm.
I don't mean you're going to drop dead. I mean, you could
Hmm.
any medicine, whatever,
Hmm.
but it literally can change the way you are. Not to mention like sexual health
Yeah.
issues and all kinds of other stuff that can happen from
Hmm.
SSRIs. So those are like two big categories of things that are given out. Like it's like you have to be on
Standard.
one, otherwise you're not part of the. Yeah, they just sprinkle it. Oh, the statins. They put the
Hmm.
statins in the water. We could go on and on about all these different medication classes.
Yeah.
Another pet peeve of mine: people that are hypertensive, but there has been no deep dive onto the root cause. And my partner, who's a family medicine guy, he's a holistic. I mean, he's like the definition of holistic. Dr. Holder. He just came
Hmm.
on with our group, and he's a concierge medicine guy, and
Hmm.
he just said it's very simple. I had him on my radio show, and he's like, it's the most simple thing. He's like, these people, they have hypertension. We get them to change their diet, right? He's into
Yes.
the vegan, like
Hmm.
plant-based thing. He's like, they change their diet, they lose the
Hmm.
weight. Guess what? They become non-diabetic, and their blood
Hmm.
pressure problem goes away. And that's the end of that. And that's
That's it.
sometimes not everybody, because as
Hmm.
you know, there's very specific types of resistant hypertension that have to do with
Yeah.
a whole other host of
Hmm.
stuff, or they could even have like a pheochromocytoma or something. Very complicated outside the thing, but generally the bread and butter patient that walks in the door that is
Yeah.
somewhat hypertensive should be approached holistically. There's so much to
Correct.
do for hypertension that has nothing to do with being on medications. Because I could tell you, if
Hmm.
your blood pressure is 140 over 90, you don't need to be started on a
Hmm.
hypertension medicine unless your risk
Hmm.
factors are so high that like you
Correct.
have to be like low, or because you have some other. And that's why I tell people
Something.
you have to talk to your providers and have a very
Hmm.
comprehensive understanding. But the average person, and
Hmm.
listen, half of America's hypertensive, right? They
Yeah.
don't all need to be on meds. You know what they need to
No.
do? They need to be on intermittent fasting or vegan, or
Hmm.
even, and the carnivore diet. The people get all whatever, but it's a good way to lose weight fast and
It
get some
is.
of the metabolic things. It's not great for it's longevity. It's not the best.
Hmm.
Sorry for you carnivore people. I always have to
Yeah.
apologize to all these people. They get so worked up.
Oh, don't be sorry, Annie. Don't
No,
be sorry.
no, I just get worked up because
Yeah.
it's like it's fun. Have you read any of Joel Furman's books, The Eat to Live guy?
I don't think I have. I
Oh,
know of him, but I don't think I've
he's
read any
all
of
you
those.
again. Another thing, I'm not trying to make you watch on my podcast, but I had him on, and we were getting along beautifully. It was great. And so until I said,
Until.
all right, Joel, here's the deal. Here's what I do. I know, because I know how he feels. He has all these books. He's very well known,
Okay.
Joel. And I just said, listen, it's not a one size fits all thing. And
Hmm.
I just say, I just want my patients to have something that they can follow. And I
Hmm.
love intermittent fasting because it's the easiest one to get people to really follow. It's just so easy because it's just like
Yeah.
you start eating here, you stop eating there. Then we work on what we're eating in that time frame. But it's
Yeah.
pretty easy. But then there's the vegan and there's pescatarian and there's the blah blah blah. There's a million other things.
Hmm.
But then I said to him, I said, oh, I started mentioning. I said the word carnivore. He went like just
Did he
blank.
lose
Like
it?
he just almost he lost it in a Joel Furman way. He wasn't like angry,
Oh my
but he's like,
God.
I have read, like tens of thousands of studies, and by far the
Uh-huh.
veganism is the best for longevity or whatever. And there's no question that if you want to live the longest, probably
Mm.
some form of vegan or vegan with a little bit of meat is the best. A
Little
lot
bit.
of
Hmm.
whole foods, nuts and seeds, all
Hmm.
that stuff, and maybe a little bit of
Yeah.
meat. That's probably the best that you can do as far as
Right.
longevity. But for some people that just want to lose weight really quick, I mean, carnivore diet's like amazing. I mean, people just they'll slim
Yeah.
down. Now, is that great for some of your biomarkers and stuff? No, I mean, some of the lipid stuff. So
Hmm.
again, you have to do it in conjunction. Some people could do the carnivore and they're great. Their numbers are
Hmm.
some
Hmm.
people have 12 eggs a day and their numbers are
Hmm.
perfect, right?
Yeah.
They just metabolize different. So sorry to go off on a huge rant. When it comes to
Uh-huh.
dieting, okay, when it
Uh-huh.
comes to dieting, let's go back to women and dieting. Because this is
Okay.
a question I really have for you, because I find that when we try to get their feeding windows, intermittent fasting, by the way, for those of you that don't know what intermittent fasting is, basically time restricted eating. You eat in
Hmm.
certain windows.
Hmm.
I just want to know your opinion. So for women, I usually do a 16-8 for women
Hmm.
when they ask me like 8 hours of eating, 16 hours. I feel like less than that. I feel like they have significant hormonal pattern changes, and then
Hmm.
then they don't feel well for a different reason. What's your experience with it? How do you do
Yeah.
your intermittent fasting in women specifically?
So if I'm starting somebody out with fasting, I always just start with 12 hours. And that's like a
Okay.
good rule of thumb. I tell most people is just start with 12 hours. So I start with 12 hours. But if I have somebody who's more advanced,
Mhm.
like I always say like beginners and
Yeah,
advanced,
yeah,
because
yeah,
there
yeah,
are like there's people who are like
yeah,
not new to the game and they've been fasting.
yeah.
Um, so if somebody's a little bit more advanced, like for me, I do like a 16-8 is my kind of like preferred. So I
Mhm.
do like that. But um I I time it out and I really a lot of what I teach is like tuning into your body and how you're
Mhm.
feeling. And
Yeah.
again, why I like using the continuous glucose monitor because it like tells you in real time like what's
Yes.
going on with your body. Um and that's been a really great way because that was making me think of something that you were talking about earlier. To know, like I learned, like talking about experiments when you're talking about experiments.
Yes.
So
Mhm.
when I was wearing the continuous glucose monitor, I was like blown away by like all the insight I got about my body and what I thought I was doing right and what my body was actually telling
Right.
me
Of
was
course.
going on the inside and just how you're told certain things are good to eat and you should be eating them. But then I saw how my body was responding to that. And I was like, holy crap, my body does not like that. It's telling me, I can see
Mhm.
it. So I like using the continuous glucose
Yes.
monitor with the fasting to really see. And you do have to use it, like, because, if you're still getting your period and stuff, you gotta be able to monitor all
Yes.
of
Yeah.
that as you're going through the different cycles and everything. So it is kind of a longer process and a little bit more trial and error when it comes to women because we have other factors influencing that. So like if somebody's doing it for PCOS,
Yes.
then that might look a little bit different than somebody who has just like a
Mhm.
regular cycle or somebody who doesn't have a cycle. So that's why I can't say enough about using a CGM because it gives you so much insight into all of that. And blood sugar, it shows inflammation and gives you so much more data about how your body is actually working and what it's doing with the things that you're putting into it. And also about how you're feeling and how you're thinking and about your sleep and about your
Mhm.
hydration and your vitamins and even your medications. And that's what I was thinking of when you were talking about those different medications, the SSRIs and the cholesterol ones and statins and all that. Those mess with your metabolic pathways and also your nutritional pathways and how your body is
Yes.
absorbing or not absorbing the stuff that you're taking in. So that's what I found has been using the micronutrient testing and the IV hydration can
Mhm.
really help some people that are having some adverse effects of like say they really need that medication to help it boost it up, amplify the results a little bit and help you feel better faster using some of these other modalities like the IV hydration and stuff. But and then using the IV hydration to supplement the fasting and some other things that you're doing.
Yeah.
So that's kind of how
Yeah.
I approach it and kind of the style that I do. But you don't obviously have to have a continuous glucose monitor fast, but I like it because you might be somebody who is on the lower side, a little
Yeah.
hypoglycemic, and fasting might not be the best thing for you. I think a lot of people are like, "Oh, I want to try it," and then they have an adverse experience with it, but it's because they run hypoglycemic all the time. They just don't know. Um, so that's where when a lot of people are like, "Oh, fasting is so terrible," and blah blah blah, or carnivore is so terrible and blah blah blah, or "Oh, this is so blah blah," and I'm like, Bro, maybe it's just not for you, but it could work for somebody else and be just fine."
You're absolutely right. You gotta titrate. I think a couple things with the intermittent fasting that was so number one, just for the listeners, the reason intermittent fasting is so good is because it can really, really jumpstart your metabolism. There's a book, my favorite book, people have heard me say it a million times. It's called The Obesity Code by Dr. Jason Fung. And it
Hmm.
talks about the science of intermittent. I give it to my patients all the time. They love it. I
Hmm.
just sit with them. I say, go on Amazon right now. We're purchasing it together.
Nice.
and they get it, and it's really informative. It's good for providers and for patients.
Yes.
But the nice thing is about intermittent fasting is it allows our bodies to throw out the trash, because if
Hmm.
you're constantly eating, you're making these waste products in all your cells, and that creates dysfunction in the cellular machinery, and it's a problem. I'm just being very generic and very general
Yeah.
about it, but it's fascinating what people can do with intermittent fasting. But I think a couple things is, one, what you eat in your, so some people that like struggle with the hypoglycemia, I think that really getting them to have like changing their diet within their
Hmm.
eating window really
Yeah.
helps them the next day. Some
Hmm.
people just need a lot more higher fatty content, so more nuts and seeds, and that helps them. It depends. It, like you said, it's such a trial and
It's
error thing. But
Yeah,
a
it's
big
a good experiment for
yeah.
yourself. Yeah.
One of the
Yeah.
things, one of the pillars, right, of good health is good sleep. I will tell
Hmm.
you, it's very difficult to be a hardcore intermittent faster if you're a bad sleeper, because
Hmm.
you're just completely disrupted, and it actually puts you into more hypo. It's just you're not your body's not functioning well. Plus, you don't feel good, and when you're kind of in that sleepy state, all you're thinking about is, man, I got to eat something, right?
Yeah.
You don't feel well. Whereas if you're rested and you get 6 good hours, or if you get what's the recommended, 7 or 8 hours as an adult, then
Hmm.
it's a lot easier to intermittent, fast. I've
Hmm.
and you also have to feel, you just have to feel it. But back to the, to women, what I have found is, at the beginning, when I became so passionate about it, I was reading all these books. I got stacks of books on intermittent fasting. Again, Obesity Code's my favorite, but I started like really trying to push some women into more hardcore. It just
Yeah.
doesn't work. I mean, they get
Mm-mm.
like completely thrown off, and sometimes they'll actually like gain weight, which is
Yeah.
really interesting, because
Hmm.
you're throwing off their metabolic. Because then if you throw off their hormonal axis, then it throws off everything, and then it's just worse, and they can have all these other things. But males, you really can push them. So for
Oh, yeah.
my guys that are like really, you talk about advanced,
Hmm.
the best window is that 4 hour window. And
Yes.
and when I get pretty hard, what I can't do with for me personally, I
Hmm.
can't do the 4 hour windows if I'm in a cycle of like working out really heavy. I can't do it.
Right.
I can't do it
Yeah.
because I get hypoglycemic. I can't do it.
Yeah.
So in
Hmm.
fact, like so now I'm like cycling more. So I'll go between 4 hour eating window and even up to 12 sometimes when I'm really working out a lot, because
Yeah.
it's not good it's not, I don't even do I do have my continuous glucose monitor, and we do that on
Uh-huh.
people, but mine is still in the package next to it.
Yeah.
I need to do it. I'll probably do it. Everything I do now, I'll do my continuous glucose monitor and do like a YouTube thing for like, 3 days in a row
Yeah.
and tell everybody,
Yeah.
everything that's happening. But so anyway, it's
Yeah.
really cool. The intermittent fasting, it's such a good tool. Let me ask you, so forget intermittent fasting for a second. In
Hmm.
general, for women, and this might not, there's probably not a good answer for this, but out of that, if they just say, I don't really want to do that, are you more in the vegan camp as far as general wellness? Are you more in the carnivore camp? Are you more in the more that middle of the road Mediterranean diet, pescatarian, all that? There's like that US News and World Report. Now there's so many diet names that I don't even,
Yeah,
yeah.
there's so many deaths. So I will say that most of the women that work with me are to some degree insulin resistant. So for what I find with them is doing not keto, but something that's very lower carb,
Mhm.
something that's very lower carb,
Paleo, like a paleo kind of.
kind of like a paleo type thing, and just in that style.
Okay.
That's really what I find works best.
Paleo is great. Paleo is
For them.
fantastic.
And I even know, like, for myself, this is just me speaking as Alex. I know for me, I have my body, if I eat any type of carbohydrate, that because of my prediabetes and because of my whole where I've been, my
Mhm.
body is wants to go back there, right? My body just wants to go back there. So for me, I have to keep my carbs very low. And I wouldn't say I'm keto, I'm not keto, but I do have some carbs, but it is very low, the amount of carbs that I have to have. Some with like some meals, I might only have like 5 carbs in one of my meals. Um, because if I go over like 30 or something in a
Mm.
day. This is how sensitive I am to, but
Yeah.
it's just stuff
Yeah.
that I've learned, again, experiment. I've learned over time
Mm.
that that's for me. And it's not always like that, but I have to stick to more of that side of it. Like really with it being that
Mm.
low, I do. Because any little bit of carb, any little bit of sugar, just my body just it does whatever it wants to do. And so that's what I really found works the best is just really sticking to that lower carb to reverse the insulin resistance and to get them more
Yep.
sensitive. And that goes back to what you were saying
Mm.
about with the
Yep.
intermittent fasting is you have to take a break. Like I always when when I'm teaching people about it, I tell them like, we're taught or we're conditioned that we have to eat all the time. And I'm like, well, if you're eating all the time, your
Yes.
digestive system is just working all the time nonstop. And I was like, all the energy that could be going to healing other parts of your body and keeping you well in other parts of your body are just going straight to your stomach to digest food. Like, what sense does that make? So give your digestive system a break, fast for a little bit, so that way it can relax, and then all that energy can go to other parts of your body to help you feel better and help to repair some of the other things that are going on with you instead of just worrying about digesting food all day long. It's crazy how much people strain they put on their digestive system. It's crazy.
No, it's huge, and not only that, obviously, like 90% of the serotonin is produced in the gut.
Mhm.
You're screwing up with that mechanism, and then you're screwing up with your microbiome by
Yeah.
eating constantly because those bad bacteria, man, they love it. I mean, people are putting down
Hmm.
all this processed food and sugars all day
Hmm.
long. Their Baby Ruth bars and whatever they're eating. I don't know why adults. I can't even look at people when they're like what they're doing. It's so I'm like this is not even. Sometimes I just watch people and I'm like, that like adults shouldn't. I mean, kids shouldn't be doing it because with ADD and all this other stuff, it's terrible for our
Hmm.
kids too. But when you're an adult, like this is not
Hmm.
like what is like who told you that was like a thing?
Hmm.
This isn't a thing. This is not normal. And you can see that with those societies. I love looking at that, like those societies where like Western culture wasn't there.
Yeah.
Those people look like they look like they should be on a stage competing for something, and then you go
Hmm.
back 50 years later and they're sick, just as sick as we are.
Yeah.
So
Yeah.
there you go. That's where we're sick. Food is medicine. Our food, we're the opposite. Food is
Hmm.
medicine. It's also poison,
Yeah.
and we're literally poisoning ourselves and poisoning our children, and it's so sad. Now back to the insulin resistance thing. I didn't even mention that before
Uh-huh.
because I did the statins, right? We talked about some of the other stuff,
Oh,
but
yeah.
oh my god, the diabetes. It's
Hmm.
people don't here's a basic thing. If you want to make people more insulin resistant,
Hmm.
give them those medications,
Yeah.
right? And they get
Yeah.
more insulin resistant, right? So they start
Yeah.
with stuff, they don't change their diets, like the
Hmm.
whatever, glipizide, they'll be put on glipizide. So they become more, and then it just worse and
It's
worse and
just,
worse.
yeah.
And you're right. So that the intermittent fasting is great for insulin resistance. There are so
Hmm.
many paths. So I want to give you the statistics. Over 80% of people on intermittent fasting go from being
Hmm.
diabetic to not diabetic.
Yeah. It
Why?
absolutely works.
But why is that not heard in every single and that's it. You
Because
can say
it's
this.
free, honey. It don't make nobody no money. It's free.
There's
That's
no
why.
exactly.
It's free.
There's no middleman that's making money. Again, going back to Dr. Furman, because he's got this program out in California. You go there and so he told me, he said it on the thing, and he has all the data. He's like, do you know how he's like, so if people follow his he calls it a nutritarian diet. He's like, if you follow this diet, he's
Hmm.
like, you know what percentage of people that come out to do my program that are diabetic come out diabetic? Zero.
Hmm. Yep.
Zero. He's like, he is
100%.
every single person has become same thing. I mean, honestly, if you go on the carnivore diet, you're also going to
Yep.
most likely become non-diet. Now, again,
Hmm.
there's different types of resistances where that's not going to
Hmm.
necessarily, and we're not talking about type 1.
Type 1.
That's a
Yeah.
totally different issue. We're talking about the diabetes that everybody in your family has that you were giving them insulin. I
Hmm.
guarantee, right?
Yeah, it was type
99%
2.
of them is
Hmm.
all type 2.
Yeah, it's
Type
type 2.
2 is a manufactured disease So
Correct.
then we can go into the whole that what we call type 3 diabetes, which is dementia, right?
The brain.
Alzheimer's
Hmm.
disease. And so we're wrecking. So now think about this for a second. Insulin resistance is directly correlated with dementia.
Hmm.
Like, right?
Yeah.
Why are we not, why, like, we're not teaching this stuff. We're not telling people that they're going to have early dementia. Look at our early dementia rates now. It's
Mhm.
exploding.
It's
And
crazy.
it is absolutely crazy. And it's such a self-inflicted wound that we're doing to our own society. So I
Well,
hope
yeah.
that the powers that be really start listening, because there isn't money in this. There really isn't money in this stuff. There's no
Mhm.
middlemen. It's the same thing, like we got, in addition, I mean, I have so many different interests, but we started this clinic and we're doing stem cell therapies. I mean, they're just like above board, FDA stuff.
Yeah.
That's fine. Like just musculoskeletal stuff and some
Right.
sexual health stuff, that kind of stuff.
Hmm.
Stem cells. The reason that stem cells got a bad name, other than I know people were doing great, just saying they're going to cure everything, and they just.
Yeah.
But the reason it got, but the reason that it's not promoted is it because if there was a middleman, it's your own stem cells. Like if I take
Yeah.
your stem cells and put them back in your shoulder,
Right.
there's no, like, they can't
There's nobody.
monetize
Yeah.
that. Only the
Hmm.
provider is getting whatever fee there is. That's it. But that's nothing. There's no industry like involved. What are they doing? Selling you a
Yeah.
centrifuge? There's no money in
Hmm.
that. Guess
Yeah.
what? If one of these companies, if J&J figures out a way to monetize it, everybody needs stem cells. There'll be so many
Hmm.
stem cell commercials, you won't even be, like you won't even be able to watch the
I'm
program
telling
anymore,
you.
right? If
I'm
if if
telling
if,
you.
if we could monetize intermittent fasting, every billboard would be intermittent fasting if they could
Yep.
monetize it, but they can't. And that is the sad thing about where, like where we're going in our
Hmm.
society. All right, let's
Yeah.
wrap up with the women thing. Our time's getting a little bit. We got to do another one, by the way, together,
Okay.
because
I love
we
that.
haven't covered. We haven't even
Yeah.
gotten that far in. We're trying to keep it like really broad. I think people really
Yeah.
enjoy just hearing people kind of like just two providers just talking about like how can
Yeah.
but going back to the women's thing, this is very, very broad, not an easy question. The more broad it is, obviously, the harder it is to answer
Okay.
sometimes. If a woman came in and you could only
Hmm.
tell them three things,
Hmm.
like do this, and that. I understand they're very complicated, but if like say you're a limit on time or they just don't, what are the three things that every single woman should do over the age of
Hmm.
40 to live their best life? Like what do they need to do? What are the three things?
Oh my gosh.
Not easy. I told you I was going to give it something.
It isn't,
I got to
it
do some
isn't
hard hitting
easy.
stuff.
You know what? It's not easy, but the first answer that I thought of, the first answer that came to my brain was to love yourself. That was the first thing that came to my brain, honey.
Amen. Amen.
That was the first thing that I
Amen.
thought of. Just love yourself. Just love yourself how you are. I think that's a good first step to take is that. Um, and I would probably teach her about fasting. I probably would teach her about fasting. Um, and I think the other thing would be to it's as bad because it's not bad, but this is difficult because it's general. But I
No, it's
think
Sujan. I knew it was going to be tough.
really, yeah, like to really have her know what kind of life she wants to live. Like, what does it really look like?
Hmm.
And to have that as like the guiding thing, like what do you really want your life to look like, to feel like? What does she look like? What is she doing? How does she feel? How does she move? How does she think? Like
Hmm.
that, because that will allow us to figure out where she, or where will help her figure out where what she needs to do to get there. So I think those are like my top three, because I always talk to everybody about fasting and loving yourself is a non-negotiable. And I think the other thing is, yeah, just really knowing what you want for yourself, for your health, for your life. Know what you want. And I think that will alleviate a lot of worry and anxiety and all those other things that
Yeah,
be creeping around causing us problems. So,
that was a great answer, actually. And again, I didn't know what you were going to say. You could have said, diet, exercise, take care. We could say anything, but
yeah.
those, like those are those questions. It's important. That's a
Hmm.
great answer. And I love fasting. Is people have like fasting is incredible. You know what? if we just had everybody doing intermittent fasting, do you know the
Hmm.
healthcare costs would plunge? I mean, just one thing,
Yeah,
like just one
totally.
simple thing. So a couple, Dr. Lustig, I watched one of his things, and I'm actually hoping to get him on the podcast. I've reached out a couple times. He'll come on because he's actually friends with a couple of the other guys I had on the show. But he made, I mean, again, these are big sweeping statements. And he was just talking about the cost of healthcare. And he
Hmm.
said, here's the most simple thing. He's like, I'm not even close to agreeing on what the American Diabetic Association says, or these other associations say about how much sugar intake should be daily, because it's way too high. And we don't have to
Yeah.
get into that because, there's a lot of jokes about like how high their recommendations are. But he said,
Hmm.
if people literally just had that amount of sugar a day in the country because we're so bad about it, he said it would be a
Hmm.
$1 to $2 trillion savings. Just that one thing, not
Yeah.
doing nothing else other than
Yeah.
cutting out sugar. So we're not even talking about toxins and processed with nothing, just the sugar.
Hmm.
So it's like, and that's why
Hmm.
fasting, when you fast, at least even if you have the sugar in that small window, that other time, right, you're really sugar free,
Yeah.
it takes a
Yeah.
while to go into ketosis. It takes probably
Yeah.
16 hours. It depends. Everyone's different, but
Hmm.
but anyway, those are little things. But the other two things that you said are awesome because it's true. If you don't come again, it's back to what we said before. If you don't take ownership over your own
Hmm.
life and accept where you are and have open, honest conversations with yourself. I'm here because of these things, and then looking forward, this is where I want to go.
Hmm.
Everything is a non-starter. You could talk to them about IV hydration and get
Yeah.
NAD and doing their hormones. That's
Hmm.
not going to do anything if they don't have buy-in. Those other two things are about buying into themselves, and then
Hmm.
just buying into the program. If they don't have that, they don't have anything. And again, I like intermittent fasting is the basic. I used to be a
Yeah.
paleo guy and tried to put people on paleo. It's expensive
Mm.
for people.
Hmm.
There's a lot of things. You say intermittent fasting, just make your window this. It's a
Yeah.
start, and then they're thinking
Hmm.
about it. At least they're in the habit
Hmm.
of doing it, and they have that
Yeah.
that that period where they can throw out the trash. Those cells.
Yeah, and just that is a huge behavioral change. And those are the hard things, the behavioral changes. And just fasting is a huge behavioral change for so many people just to think about that and actually do it. So it's like a step by step, like it takes time. It takes time. And I think that's what people have to think about also is, your health, it's the long game, is long term.
Mm.
And I think we think a lot in like these short little, oh, I gotta lose 10 pounds for the wedding, and oh, I gotta lose 10 pounds for this or for that. Like that's how so many people, like how many people live their lives like that? Like just in these short little bursts. And I'm like, you're never getting anywhere by doing that. And so just really thinking about it like the long term and for my longevity. Like we didn't really talk a lot about longevity and stuff like that, but like
One of my
your
favorite
long,
favorite favorite
yeah,
topics.
your whole
Yeah.
life, like what are you
Yeah.
doing
It's it's
for that?
it's funny. It's my favorite term, and
Yeah.
it's funny because we kind of say some of the same things. I'm from the Bronx. I'm pretty matter of fact, but that's one of my favorite
Hmm.
sites. Like, what are you doing?
Yeah.
Like, what
Yeah.
is
It's
it
so
that
funny. I
what are you
use
doing?
that
Like
phrase
what
with my kids all the time.
what are you doing? Like, what do you do? Like,
What
what
are
are
you
you doing? It's
doing?
like so. And listen, not that I don't do
Hmm.
boneheaded stuff. We all do, right?
Yeah. Yeah.
But as a total, like you really have to think like, can you continue to live these horrible? I
Hmm.
love lifestyle medicine. It's really become like
Yeah.
my mantra. But can you really continue to live this lifestyle over a
Hmm.
long? It's not sustainable, and people don't find out until they find out,
It's
and
too
then it
late.
ain't
Yeah.
good. And then they're like,
Yeah.
oh, I didn't know. One of the things
Well,
I always talk about, and I've actually done a couple posts on it, is I hear like I sometimes I'm outside the ICU. Speaking of the ICU, because you were talking about your experience in
hmm.
the cardiac
Yeah.
ICU, I hear these like just really smart people, right? They're sitting there, they're next to me in the doctor's lounge. I'm writing my, I might be writing my note on a case I just did or something. And then
Hmm.
I just like kind of tune in to what they're talking about. And they're like, oh, they're running the list, right? So for people that don't know, running the list means going through everybody that's in the ICU and everybody you're covering, and
Yeah.
you're just running the list. So they're running the list, and this one needs to go to dialysis, and this one needs a cath, and this one
Hmm.
needs that, and this one's been intubated for 6 months, and they're still there, and they're metabolic. and that's great. And we need right, and we're able to, you know what, modern medicine can keep those people alive. They can get a lot of those people out
Mm-hmm.
of the hospital. Not everybody, but a lot of those people walk out. It's pretty crazy that they can
Mm-hmm.
walk out, because 40 years ago they weren't walking out of
They
anything, right?
weren't.
Modern
Yep.
medicine is
Mm-hmm.
definitely improved. But the thing I always say is, I get that those doctors are thinking that way, but that's the wrong question in our society. Obviously, we need brilliant people helping those people. The right question is, why are they in my medical ICU? What was
Mm-hmm.
their lifestyle? What did they do for their last 20
Mm-hmm.
years? Like your lady, what did she do that at 39 years old or whatever, however,
Mm-hmm.
35, 39, whatever
Yeah.
you said she
Mm-hmm.
was?
Yeah.
What led to that? There is a blueprint for that. There's a blueprint for
Mm-hmm.
being having a great life, and there's a blueprint for that. And people
Mm-hmm.
unfortunately follow that, and that's what we really have to get. And so for me, one of the more important things that I want to bring into the kind of the million, and this is not happening, the people that do survive those things need hardcore education on how to change their entire lifestyle after that. They get a
Mm-hmm.
little bit of it. There's some classes, there's some other stuff, but
Yeah.
they need to sit down with you and have,
Mm-hmm.
as we say, right? And like, again, I grew up like hardcore Catholic stuff. It's a come to Jesus moment.
Yeah.
Like you
Yeah.
almost you almost met your create, if that's what they believe. Everyone has different beliefs, whatever. But I'm like, you
Mm-hmm.
almost met whatever you're going to meet, whatever the afterlife is. You were almost there. But
Or honey, how many people do die and come back? Like,
yeah,
come on. Like, mm.
yeah, they come back, but and then they go back, and then they have
Yeah.
COPD and they're smoking
Yeah. And you
like
see them a
the
couple
next
weeks
day.
later.
And
Yeah.
you're
Yeah.
like, yeah, yeah, that, like you said before, it just bothers you, these repeat
Yeah.
offenders. So, I think we got through a lot. You know what I wanted to, kind of get through, and it again, we'll do it, because I definitely want to have you back. Like, how do you
Okay.
treat, like, specifics, like PCOS, like
Mm-hmm.
how are you treating that? Like the whole adrenal fatigue syndrome, which
Mm,
is
yes.
fascinating to me, because there are corporations that have spent money to try to put out articles and all kinds of other stuff saying adrenal fatigue syndrome is a
It's not real.
fabrication
Yeah.
of like the integrative and functional medicine community. And
Mm-hmm.
but why do we allow this stuff to even happen?
Mm-hmm.
Syndromes that we all know are real. And then people are like,
Yes.
there's all this misinformation put out, mostly by
Mm-hmm.
corporations, because they
Yes.
love these people being sick, because they want them to take
Mm-hmm.
their
Their
drugs.
medicine. Yeah.
The
Mm-hmm.
one thing, so there's so much to cover in women's health and functional medicine, more the hardcore stuff, but this is great, like just kind of getting to know who you are. And I think
Yeah.
your clients are going to love this, because they're going to what, they're going to say, hey, I don't get to speak to Dr. Rosa for 2 hours. So
Yeah.
now I kind of know who she is and what she stands for and what she's about. And hey, she
Yeah.
struggles with stuff just like I do. I struggle with
Yeah.
plenty of stuff. I talk about it all. I mean, let's
Mm-hmm.
not like, but I go through my things. But the one thing I did want to ask you about, a couple of
Yes.
things, because I do want to ask a little bit about biohacking. But before we get to that, GLP-1s.
Mm-hmm.
How much do you incorporate that? I know you say you don't necessarily do prescribing. I have come around. I think that it's I'm definitely more of a lifestyle guy. But do we
Mm-hmm.
treat people with GLP-1s? Absolutely. Especially in
Mm-hmm.
my spine clinic, they're just people off the bat. I said, listen, there's all kinds of lifestyle stuff, but your A1C is 11.7.
Yeah.
You're 130 pounds overweight. GLP-1s. Yeah, there's side
Yeah.
effects, and we could talk about that all day. But so what's your thoughts on GLP-1s and integrating that into your own kind of
Yeah.
practice?
No, I think I'm kind of on the same wavelength that you are. I
Yeah.
think there's some people who absolutely like they're going to die.
Yeah.
Like their lifestyle is going to kill them. Their habits are going to
Yeah.
kill them unless they get this
Yeah.
GLP-1. And I've actually had a lot of conversations with students about these types of medications because we get severely obese, 500, 600 pound patients, and they're literally telling them go home and eat a low-fat diet when they're that big. And I'm like, bro, this person needs shots. Like, this is the person that needs a GLP-1. Like, this is the person.
That's who needs
You know?
that's who needs it.
Yes.
And
Yeah.
it's a stat issue. I'm like, you need to be on
Yeah.
that tomorrow.
Hmm.
Let's get it
Yeah.
going. Yeah.
And I think that goes to further like what you were talking about when we were talking about cholesterol and some other things like
Mhm.
triglycerides and
Yeah.
A1C like you have to look at the whole picture. Like just because your cholesterol is high, it doesn't really mean anything unless maybe your A1C is high and your triglycerides are high and all this other shit. Then yeah, maybe you do need that for a little bit until we can get some other things under
Go.
control. But like GLP-1s, I'm not against them. Like, and I've made a couple videos and I keep it very real. I'm just like, listen, you're an adult, you're gonna do what you're gonna do. And if you're gonna get on a GLP-1, then you're gonna get on a GLP-1. But know that there are XYZ side effects to a GLP-1, and you need to be aware of those,
Mm,
and you need to know that you are going to have to do X, Y, and Z while you're on these medications, certain lifestyle changes and changing how you eat and some other things. I said, and then you're not going to be on it for the rest of, I mean, maybe you could microdose. We're not going to do a whole show on
yeah, yeah, yeah,
microdosing here,
yeah.
but like maybe you could microdose here and there, but for the most part, and listen too, I get so many emails every day from all of these compounding pharmacies that are
Yeah.
like, "Oh, we're not allowed to make, this compound of this terzepatide, and we can't make this
Mm,
anymore, and you're not gonna be able to get it." And it's just like crazy how they're playing with distributing that medication. So I'm like, I can't even like guarantee somebody's gonna be able to get it, even if I was gonna prescribe it to somebody. Like, I can't even guarantee I'm gonna be able to get it to you. So that was a side note, but they like you're not going to be on this for the rest of your life. Like you're going to have to take some accountability, some
mhm.
control over the situation at a certain point. Or when you do get down to your goal weight, what are you going to do then? Like you're going to have to know how to maintain. And a lot of people's brains don't catch up to
Mhm.
their body. So their body looks one way, but their brain is still thinking another way. So that's what I think about that. So I do see a lot of people though, because I do say that IV hydration is a really great complement to somebody on a GLP-1 because they're not really getting
Absolutely.
a lot of the nutritional things. They're getting dehydrated, or if they are having vomiting or diarrhea with their GLP-1, like there's some things that I
Mm.
can do on the IV hydration side that will help them work through that till they get their dose adjusted or they get used to the medication or whatever it might be. So there's a couple things to that, but GLP-1s, I mean, they're here, they're not going anywhere. Getting more popular. I mean, I think what is scary to me though is all the places that are popping up where you can just click a button and get it.
Huh.
And I think that is like so horrifying to me that and it's just and it is like it's kind of like the Walmart situation too. Like it's like a race to the bottom. Like some places are just getting cheaper and cheaper with it, and that's what people are looking for is cheaper and cheaper. And I'm like, you're playing with your life when you're doing that. And I think that's like one of the scarier sides of it that I see. So not so much that I'm like against people taking it or doing it. It's just like all these places that are popping up where people are selling it. And I'm like, that is just so crazy to me. That is
No,
just so wild to me.
you just hit a button. You just hit another one of my pet peeves, and so it's really interesting. Race to the bottom. Absolutely right. What was so interesting is during the Super Bowl, there was a commercial from Hims and Hers, and that
Yep.
commercial, it started so good. I'm pumped up. I'm like, oh my God, am I about to get goosebumps here? So they just started showing how the chronic obesity problem in our country and metabolic health and just saying, oh, it's a mess. And then they went right into buy all our GLP-1s
Yeah.
and kind of normalize the whole thing. And again, it was just interesting. And I posted and I got to go, like the responses were amazing on that post because people were really dialed in, and a lot of physicians
hmm
and other providers were like, yeah, it started good, and then all they want to do is sell you these drugs. And you're absolutely right. The problem with giving out those things is that you really need guidance. And so
hmm
before I even thought about it, I really had to think about if we're going to give people GLP-1s, we really have to have a very comprehensive program. So that comes with
Yeah.
educating them on the fact that they
hmm
need to take in a huge amount of protein to maintain their muscle mass. And that
hmm
still won't do it because they're still going to
Yeah.
lose muscle mass because you can lose
Yeah.
40%, sometimes more. of your muscle mass. And so people are very unhappy about that. And then we ended up bringing in all these body contouring devices and then just hitting them like with, like, for example, like the BTL, we have the BTL suite, we have like all this stuff where you just do electromagnetic stimulation and some other things to really strengthen their muscles. Cause some of them
Your
are so
muscles.
debilitated. They're so obese. And now you're putting them on that. And now they're just like
Yeah.
no muscle. They're just wasting away. So you want to stimulate their muscle.
Mhm.
We have these myostatin blockers. We use something called MYOS, this kind of protein powder that you take that can block,
Mhm.
that thing that breaks down muscle. So to help them keep the muscle, but also IV hydration. Big believers in IV, micronutrient dosing. All of these
Mhm.
things are so important. If I just go on right online right now and they send me my GLP-1, who's managing your side
Yeah.
effects? Who's managing all the medicine that goes into it? Because you can actually do the GLP-1 stuff with and minimize your side effects, minimize your muscular loss, but you're not going to do that if you're doing that and then you're looking at TikTok to figure out how to deal with your symptoms.
Yeah.
That becomes like everyone's practicing medicine now.
Yeah.
And you're taking your life into your hands, and GLP-1s, and again, and it's not without stuff, and we are going to start
Mhm.
seeing
Mhm.
things where, because GLP-1s directly affect the pleasure reward center of the
Yeah.
brain. And I had Dr. Blum on. He's basically the leading like neuropharmacologist in the world. The guy should have had a Nobel Prize. He actually discovered the gene for alcoholism, and
Mhm.
he's very concerned about GLP-1s. In fact, he's written many things to the NIH and to other governmental bodies saying, I'm
Mhm.
really worried about this mechanism of action over the long term. Not
Yeah.
to mention when they get off of it, right? If they're
Yeah.
not under good supervised care, they just,
Mhm.
I mean, literally they explode back to where, they were before. So you have to be really
Mhm.
careful, kind of up and down, very similar to way we give people
Mhm.
other types of medicine. So thanks for that answer. That's great.
Mhm.
And you're right. I don't think that we should just be just like throwing this stuff out there. Biohack, other than IV hydration, which I'm a huge believer in. I mean, I do it myself. I mean, it's really amazing, and people should
Mhm.
think about it.
Yeah.
Have you incorporated other, I know you kind of see my stuff, and you know how big I am into like the light therapy and oxygen and all this other stuff. Have you
Mhm.
incorporated that yet into your practices?
So for me, so my practice is mostly virtual, what I do. So if I do partner with a lot of different places around, and so I refer people out for a
Okay.
lot of things, depending again on what they're coming to see me for and what result they're looking for. But as far as when somebody's coming to see me, like in person for IV hydration or something, I'm doing that, doing some peptide
Mhm.
therapies with that also. And I love that's why I love following you too, because you do a lot of the things that I refer people out
Yeah.
out for if they might want to do like PRP for something or
Hmm.
some other different types of treatments. I used to refer people out for like scrambler therapy for neuropathy,
Hmm. Hmm.
um, some different treatments and just things that I would be aware of. And I'm like, depending on where you're at, how available it is, and it might be something that you might want to look into. And so I'll kind of counsel people, do a lot of consulting around that, and refer people out for different things if I
Hmm.
feel like they would benefit from it. Um, but like for me, uh, or like red light is awesome. I've done that to people because I've had access to some equipment, so I've done it before. But red light therapy is amazing for all types of different uses. Um, and I actually got I got my husband for Christmas like a grounding mat.
Oh, I
And I hooked him
100.
up. I hooked him up for Christmas. I got him like grounding mat. I got him like an indoor sauna
That's
thing
awesome. Yeah,
also.
hey, listen, we have
So
my house is a biohacking clinic.
yeah, yeah, just like
Yeah.
really just bringing all that stuff
Yep.
into your home because a lot of it is, you can
Yep.
have all of those
Yep.
things. Again, just depending on whatever result that you're looking for. And like for me, I always have like my clients get some type of like
The
ring. This is
aura, the
like a
aura ring.
Samsung
Yeah.
one. Yeah, this one I use the Samsung one
Okay.
just to kind of track everything because it was funny you were talking about sleep earlier because I've really the reason I switched to this from like a other manual tracker was that I wanted to monitor my sleep more
Mm-hmm.
and see how my sleep has been doing and improve my sleep. So that's been a really great thing is using that. So there's different modalities that I like to use. But th those are just kind of some of them.
And that's great. No, I've become like a big biohacker. I mean, we're and I talk about this. You mentioned before Lyme's disease. I mean, we've got this Lyme's disease
Mhm.
protocol. Again, not medical advice, but it's pretty incredible the way that these people that have negative, they're negative titers, right? So they go to their infectious disease,
Mhm.
and infectious disease is like, what? I mean, what do you want me to like? What do you want me to do? There's nothing to do, right? There's nothing to do. And these people
You just
get on
got it.
these rounds of antibiotics when they have negative, all this stuff. Lyme's is
Hmm.
these people are really struggling. So
Hmm.
we've got some people. We have a guy that's like in the middle of writing a book. He's traveled all over the country. He's found like really good relief with some of our protocols, but it's what light
Hmm.
therapy can do. I think for skin stuff, I think the home stuff is okay. I think for
Hmm.
treating like the brain and treating like autoimmune
Yeah.
disorders and stuff, you need the
The
beds like
medical
you
grade.
need the
Hmm.
medical grade. I mean, our bed can give you
Hmm.
100,000 joules of energy in 20 minutes. I mean,
Yeah.
you're getting a lot of light. You'd have to
Hmm.
be with your panel for days to get, that
Yeah.
number. You just
Yeah.
can't. And then the
Yeah.
laser, the laser therapy penetrates deep, so then you can get into other areas. Like we use specifically the laser for the brain because it penetrates better than
Hmm.
LED light and treating concussion and all kinds of stuff with amazing results. And so I'm very
Hmm.
big into it. I love the photobiomodulation, but when you
Hmm.
combine those things with oxygen and everything, and then you get the
Hmm.
IV hydration, and then we're going to finish it with peptides. Peptides is like
Hmm.
my favorite, right? That's a whole show
Yeah.
on
Yeah.
peptides. So other than BP 157,
Uh-huh.
which people are actually starting to ask about that, right?
Yeah.
157. Again, not medical advice, but
Right.
something that, that's something that I know a lot about as far as healing, like even BP 157, like patients
Hmm.
post-operatively should be on it because honestly, it
Hmm.
heals tissues a lot faster. You literally
Hmm.
heal. It's like, BP 157 to me, and there's other ones, but it's like the Wolverine,
Hmm.
it's the Wolverine peptide, like, right? He
Yeah.
heals, right? You stab the guy and the thing heals. Like, why would you not? Why is the general medical community not interested? Is
Hmm.
there another like favorite peptide that you like or anything like that?
So
Yeah.
it's funny that you're asking that because I had just put out a post a package that I had put together for PT 141
Mm-hmm.
because I have a lot of clients who I had people start asking me about this is how it came about was I had a lot of people start asking me about it. And then I was like, "Oh, I know about it." I said, "But I really don't have like anything like I wouldn't just want to like give it to somebody.
Right.
You know what I mean? Like I'd want to create something around it to support them." So I had put together like a couples package that went along with it
Mm.
for that. But PT 141 is pretty amazing because I have so many people that ask me about it. And I do talk I have talked a lot about sexual wellness
Mm-hmm.
for women. And so that's been a really great thing to introduce women to because they really like that whole sexual arena too is like very taboo for a lot of women. So just even introducing them to like an option like that is really fun for them. So that's been really great. So that's been another
Yeah.
popular one, the BPC 157. I'm
Yeah.
actually trying to get my mom on it
Yeah.
because
BBC is it
she just had
is.
shoulder surgery. She's got shoulder. She has again her type 2 diabetes and messed up her shoulder. And so she's got a lot of complications and a lot of not so fast healing from that. And so she's been having a lot of really great like anti-inflammatory results from the IV drips that I've been giving her,
Mhm.
where, she's been going to therapy and they're like, man, you're moving your
Yeah.
arm like so much better, like you're up however many degrees today. But I did talk with her about wanting to see if maybe we could try some 157 and see how that might improve and prevent some future things from happening for her. So that's another good one that I like. Those are like the 141 though is kind of like the one that I kind
Yeah,
of
it's
have a lot
interesting,
of.
and there's a lot. We actually have like we've gone it down to 10. So we have
Uh-huh.
because other listen, I have peptide handbooks all over the place.
There's so
You
much.
could get
There's
into the
so much.
weeds,
Yeah.
but what I want to tell people
Yeah.
about peptides, which is cool, because again, as soon as we start talking about things that we could do to treat ourselves, which are honestly, yes, people
Mhm.
are paying out of pocket, but they're low cost.
Yeah.
Compare peptide. You know what? Go to the pharmacy and don't have insurance and see what they're going to charge you for some of these meds,
Exactly.
and have
Get that
fun.
hospital bill,
Yeah,
honey.
yeah,
Mm.
have fun with that stuff. So when people are like, "Oh, I don't want to pay a couple $100," I'm like, "Do you even know what healthcare costs? That's
Right.
nothing,
Nothing.
nothing." No, I get
Hmm.
it, but it depends what people want to spend on. But the interesting thing
Yeah.
about peptides, I just gave a lecture, I just gave a keynote at this meeting out in LA, and it was just about
Hmm.
regenerative medicine as a broad topic, not
Hmm.
just stem cells, but peptides and
Hmm.
photobiomodulation and actually scaffolding, something called like nanoparticles and nano. There's all the stuff that is in the regenerative medicine thing, but the history of peptides. When people think peptides are taboo, well, here's a peptide, insulin. You ever heard of
Insulin.
something called insulin?
Yes.
Oh,
Yes.
GLP-1, the thing that
Hmm.
everybody must be on because, right? Nova
Hmm.
Novartis tells us we all have to be on right? All the companies tell you that, but yet they don't want the compounding pharmacies to do it because
Hmm.
they're dangerous. Well,
Right.
again, not medical advice, but there's some stuff going on. And it's funny
Yeah.
because when Hims and Hers, they just purchased an entire compounding facility,
Yeah.
which then made one of the big companies have to lower their prices for their, because they're like, we're screwed.
Yeah.
We're like screwed because these guys are going
Hmm.
after us. It is just, and it's too bad that it's about money, because it's not about
Hmm.
money. But yeah, just all I tell them that I'm like, listen, insulin's a peptide.
Hmm.
Do you know people that are on insulin? Yes, doctor.
Yes.
Does that seem like a scary thing? No.
Yeah.
Well, peptides are not scary. They're sometimes
Right.
made to be scary because people, don't necessarily want you to be on it. I'll share a story with you. It's funny because you mentioned the thing about talking about like sexual health,
Hmm.
and especially like women's sexual. I mean, I have no problem talking to men about that. They've been asking me for
Hmm.
years. I don't know. So even at the
Yeah.
beginning of my career, I'm like, why are you? I don't know. Go to your urologist. I don't know what you're
That's
talking.
fine.
But now now I'm more in that field, so I can counsel
Hmm.
them and things like that. But with women's stuff, I really like. That's not. I'm like,
Hmm.
I'm a spine surgeon. That's not my area. Oh my god, I don't want to talk
Uh-huh.
but now like getting into integrative health. So it's funny because two of
Hmm.
my two of our nurse practitioners, one was an OBG and the other one was a fertility specialist,
Oh,
and so they came and
awesome.
joined us. And then we have like our master esthetician, we have all that. There's a lot of women, and
Yeah.
sexual health is a big thing. People are coming to these
Hmm.
clinics for sexual health reasons.
Yeah.
It took me like, this is the first time I've divulged it. I don't even talk about this stuff. I'm having trouble talking about it now, but it literally took me, they all laugh at me because there's certain terms. It took me like 4 or 5 months before I even wanted to like talk about this stuff.
Oh,
Because we
uh-huh.
have all this, like the vaginal rejuvenation
Yeah.
lasers and all this stuff. And
Hmm.
now we're actually bringing in like the regenerative medicine, doing the O shot and the other stuff. And I
Uh-huh.
was like,
The injections. Yeah.
yeah, the injections are great. I mean,
Yeah.
it's fantastic. The results are good. The results are what they are, right? Like they
Yeah.
are what
It
they are.
works. It works. Yeah.
I know. I mean, it works, but just even like the Thermiva laser that we have, like the results
Hmm.
are good. And it took me about 4 months to be able to like even broach that subject. And then once I was
Yeah.
comfortable enough, then everybody wants to talk to you about it because people, that's
Uh-huh.
important to people. They want to,
Hmm.
they, especially in our
Yeah.
society, especially when you have metabolic dysfunction, turns into sexual, dysfunction. And that's one of the
Right.
things
Yeah. And the side effects for medications, all those meds.
100%, 100%. But if you, as a
Yeah.
good way, like with the diabetes thing and like the
Hmm.
A1C, like if you want to scare young men, you just say, well, you want to have ED by the time you're 30,
Hmm.
but keep doing what
Hmm.
you're doing, and you
Yeah.
will. You'll
Yeah.
need medications for that at a much younger age than it should be. So yeah, it took me a little while to be able to, like not turn. I have enough
Hmm.
melanin in my skin, but I would think I was getting pretty red, even just kind of
Yeah.
talking about that stuff. And then you're
Yeah.
surrounded by all these like these women's health types, and
Uh-huh.
how those conversations go, and I'm like,
Hmm.
now it's just like, now it's normal. I talk about that stuff all the
It's.
time, and it's good because it's
Mhm.
important, and people
Mhm.
and people want to know that, and they're coming to you as a provider. They just they
Yeah.
want help with stuff. I'm not saying I'm not an expert in women's health, but at least I can direct you either to one of our providers or to a great
Correct.
OBGYN or whoever, but
Hmm.
I have to be able to identify those problems to do it. So thanks for bringing, I'm glad that you kind of went to that,
Hmm.
topic because it's so important.
Hmm.
And so many women in their 40s and 50s and even young, I mean even younger, but like the older women, they don't want, like they're having a lot of issues,
Hmm.
but they don't feel comfortable, or their providers are not comfortable talking
Right,
about it
talking
when
with
they go
them.
to their GPs, or they
Exactly.
just don't know. Like they're
Yeah.
not going to say, oh yeah, there's this thing, there's regenerative medicine, there's this laser you could do, and there's all these things. They
Yeah.
don't know.
They don't know. I can't even tell you like how many other medical professionals don't even know what like IV hydration is. And I'm like,
Oh
you
yeah,
know
the
what it
basic.
is. Like, you know, but you
Yeah.
don't know how to use it this way
Right.
to prevent all of these problems. You just know like let's bolus somebody because they're going into shock. Like that's what they know. But it's something entirely different. And it's amazing how much is out there that so many people are unaware of. And it's changing every day by day by day. And but I think that's what's so amazing is with providers like you and me, like we know about these things, we stay up to date with these things,
Mhm.
and we can just refer and just suggest that there are options out there for
Right.
you to look into. And then you can decide what you want to do. If you do want to do that, you can decide, but you don't have to suffer with what you got going on.
No, they don't know. I mean, and they don't know, and that's why it's good.
Oh,
And again, I'm not telling every spine surgeon in America they need to know about, like, that kind of stuff. They don't. But it is nice to do, to do that, especially if
yeah.
you go down. Yeah, not everybody. I mean, but
Mhm.
you don't know because people are they really, are suffering, and women's issue. And to be honest with you,
Mhm.
we kind of like it's beyond the scope, but in men's health, I can tell you,
Mhm.
right, without divulging anybody's names, a lot of people that are colleagues of mine and friends, they now are at our clinic, and they've gotten a lot of
Yeah.
different treatments, and it's made a big impact. And
Mhm.
the unifying thing is that they asked for help because they're in the business. So they
Mhm.
go and they say, you know what, I'm having this. It's fine. You don't need that. Oh, exercise, fine. Like, but they're not having these more, like advanced, options for them. And
Conversation.
it's
Mhm.
great, like in the men's health thing, and they just get blown off, and they're just like, well, should I have my testosterone? No, that's dangerous. Well, yes, if you have prostate cancer, it sure is dangerous, and you shouldn't be on it.
Mhm. Mhm.
But that a lot of those myths were debunked about it causing it a long time ago. Again, I'm not medical
Right.
advice, but I'm just saying there's reasons
Yeah.
that people don't want. I know a guy, a colleague of mine, his testosterone level. I just started asking him questions, and he said, oh yeah, I got mine checked. I said, oh, what's your testosterone level? He said 76. I was like, that's
Mm,
lower than it should be, like in a teenage girl, for example.
yeah.
Like really bad stuff. I was like,
Oh my
how do
God.
you leave your home? And of course he went on replacement therapy. Like he's one of those guys, he's an awakenings guy, right? It's Robert De Niro, he can't
Mhm.
move. And then,
Uh-huh.
oh my God, the grass is green. I
Mhm.
get like, it's a complete, I mean, that's disastrous amount. Like that's like he's
Mhm.
almost on, like a blocker. I mean,
Yeah.
that's testosterone blocker level. It's pretty wild. Last thing, and the IV hydration thing, I agree with you. Same thing with light therapy, IV hydration, all these
Mhm.
things. It's amazing how much providers don't know. I give lectures
Mhm.
on light therapy all the time. How many people have ever heard about photobiomodulation or red light therapy? I gave
Mhm.
100 people were in the room, 2 people raised their hands. These are
Yeah.
providers.
Yeah.
Providers. They don't even know. They
Yeah.
do not know because we're not focusing on this stuff. And me personally, love
Mhm.
IV hydration. Get the
Mhm.
glutathione going, the high dose
Yes.
vitamin B and everything. I was like, it was like
Mhm.
maybe I remember like a couple of weeks ago, I was done. I was in surgery all day, and we had a big board meeting, and I just went in and I had one of my nurse practitioners. I was like, give me the IV hydration. I was completely spent, gassed, and I
Mhm.
walked out of there perfect.
Yeah.
And
It's amazing. It works so fast.
and it
I mean,
wasn't like I wasn't even dehydrated or anything. I just didn't feel.
mhm.
I just needed all those nutrients. I needed that,
Yeah.
and I love it. And yeah, you'll pee yellow for a while when you get
Yeah.
obese and stuff like that, and whatever. But it's fine. It's great. You feel amazing, and people
Mhm.
they're not. It's like in primary care medicine, the simple stuff like IV drips, it's like a
Hmm.
basic thing. Like
Yeah.
why primaries are not offering that in their offices? It would be a revenue stream for it's
Mhm.
great for those of us that are doing integrative health, but it's not good for the population. You know, it's good
Yeah.
for those of us that do it. So you have a book coming out and you have the title, the name, when's it
I
coming
do
out,
have the
all that
title.
stuff.
I do have the title. So it's called the Women's Holistic Biohacking Guide. And so it actually covers a lot of the topics.
Yeah.
Funnily, that's not really a
Yeah,
word,
that's
but
not a word.
it
We just I make up words all the time.
we
It's
just make it up words.
yeah.
It actually has most of what we talked about today is in the book about just some basic
Mm-hmm.
things that you can do to really get back in tune with your body and work with your body. That's like a common theme for me if people don't notice, but that is.
Oh,
And that's really what this guide is all about. I kind of talk about some different myths that we actually covered today about the eating all the time and about the low energy. Like it's just not normal to not have energy. Like it's a
mhm.
sign, it's a signal, something deeper is happening that's causing that. So I really go into a lot of those common things about hormones and about energy and about our weight and our bodies. And I go into that. And then I block off very simply, I lay out step by step things that you can do to totally reset your metabolism, bring your body back to life and start working with your body. And I walk you step by step. It's basically like one of my programs, just like in a book for people to consume. So it's called the Women's Holistic Biohacking Guide.
Oh, excited about when's it come out?
So I'm hoping by April to have it out. So it very soon.
That's awesome. I'm in the same process. Mine won't come out till the
Yeah.
summer, but
Yeah.
it's mostly because the editing process is not easy
Mhm.
on
Yeah.
these books. So the publisher is waiting for my edits so they can do their edits, and I'm taking my time because I'm so critical of every single word that I
Oh,
say.
I know.
I'm
Yeah.
so I'm like every word could be taken a certain way. So like I mean, talking about combing that thing over and dice, it's a big rant. I tell people it's like a 250-page absolute rant. It's like just me talking.
Mhm.
So I have to like really be careful. I want to be careful. It's very it's just truth. It's just
Mhm.
truth. That's
Mhm.
what I have there. Some people are not going to be
Mhm.
happy, and that's not my problem. So,
It's
there's
not.
that. Not my problem. You know what? If you don't like the
Right.
truth, change your behavior or the way things are and whatever. And when I say the people, I mean more the industry and systems and things like that.
Yeah.
How do people find you, and is that how they get into your 90-day program that you talk about? Is that kind of all wrapped into like how does it work for people?
So if you do pick up the book, definitely there's all my contact info
Mm.
is in the book, and it is kind of like an intro
Yeah.
to what it is like, my kind of philosophy and my
Mm.
approach to
Yeah.
things. But if you do want to connect with me, like pretty much any place you're watching this live stream or this show when it
Yeah.
goes out, I on Facebook and LinkedIn. You can find me at Dr. Alex Rosa or just direct message me, just directly message me. I always tell people that's the best thing. Just like, hey, I saw you on that show, and
Yeah.
this is what you talked about. This is what I really liked about it. Um, I'm on Instagram, not so frequently, but you can find me there also. And I have different ways that people can kind of get a taste of me. I actually have a newsletter that goes out. It's called the Biohealth Bite. So I always tell people like, if you want that, comment bite me, and
Oh, cool.
and then I'll get them hooked up with that. So that's another thing, and that's kind of maybe a video or something that I'm sharing related to health or mindset, something that's holistic and biohacking. I will share through there. Um, and my 90-day program, I actually have a new one coming out now. It's called The Comeback, and it's actually
Cool.
my hormone and performance protocol. So it's for women, and it's really geared towards I've actually been doing a lot of remembering about my childhood recently, and I forgot like how active. It's crazy the things that we forget about our childhood. And I really remembered how active I was as a kid. I was very much a tomboy, very into a lot of sports and very active like that. And I think there's so many other women that are kind of in that boat where they were very athletic when they were younger, and
Mhm.
maybe even
Yes.
still they're an athlete now. And I think athletic too is it's of a mindset, right? It's not a certain body type, but it's a mindset. And a lot of those people also fall into the ones who are entrepreneurs and business owners. They're high performing people. So that's who this program really is geared for. And it's for that person who really wants to remember to have that comeback to their body now that they are a little bit older and things are kind of changing and maybe a new diagnosis or something different's going on with your body. And you really want to just have that comeback. You really want to reclaim your body and just have it performing at that optimal level. It's an intense program, definitely. It's not for like a beginner. It's definitely for somebody who's been there, who knows what they got to do and just wants to have their own comeback, basically. That's who it's for. So it's a new 90-day program that I have. So if you're interested in learning more about that, just contact me directly from whatever platform we might be watching on or connect with me on LinkedIn for sure.
No, that's awesome. I love that, the comeback. But not only that, it's important to come back. Love that title of that, but it's important to make that comeback because if you're
Mhm.
40 or 50, I'm 51, so and now like I'm watching a lot of men around my age, they need to make a comeback because otherwise
Hmm.
there ain't going to be any coming back pretty soon.
Right. You're
So
gonna come back
now
to
this is a
nothing.
great like that 40 to 60 range.
Mhm.
That's where you make your comeback because
Yeah.
there I'm not saying there's never a point where you're too far gone,
Right.
but what a
Mhm.
great time, kind of in the middle times, we'll call them. I don't like the word middle age. That
Ah.
seems like I feel like that gives me anxiety, but for me and my 50s now, but that it's a great time to come back and people really do need to do that because I don't want to say there's a point of no return, but there's a
Hmm.
point where it's rough. It's hard to get back. But if
Yeah.
you make that comeback before things are, like you're just too wrecked, just trying to use lay
Hmm.
terms. That's how I talk to my
Yeah.
patients. I'm like, you're going to be just like destroyed. Like we get to piece you back together pretty soon, like, Humpty Dumpty stuff.
Yeah.
But anyway, yeah, I think it's great. I love that making that comeback so that you can spend time as we age into our 60s and 70s and 80s. We can spend time with our grandkids and do those things and like really enjoy life. How many of our colleagues spend all this
Hmm.
time working day and night? They're in the system, they're on the hamster wheel, they retire and they're sick. And doctors and nurses, terrible about taking care of themselves. Terrible. Like my thing, and I'm going to do this. I promised everybody I would do it. My part, everybody wants me to do it. I got to get I got to get I got to figure out how to do it. I'm going to do the time lapsed photography of the donut stand in the hospital. It's so fast. Those things, they bring them
Oh,
out. Those things are, the fruit's there. No problem. The fruit just stays for all day.
don't
The
get me
like the
started.
sweets, time last
I can't.
they're going in there like it's like, oh my god, this is like the greatest thing, like, and I'm just want to stand there and be like, really,
What are
really,
we doing?
really, you're
Yeah.
you're you're in healthcare. You just came out of a cabbage surgery and then
I
you go
know.
to that. Like,
But
this is
let's.
what we're doing. So anyway, we can go on. I mean, this has been like
I know.
really, this has been awesome. Really, really a fun,
Good.
conversation here. We can get like a little bit more in depth. Maybe we'll do this a little bit
Sure.
later this year, do a, another podcast together. For
Yeah.
anybody that doesn't follow Dr. Alex, I notice you call yourself Alex,
I usually go by
Alexandria.
Dr. Alex.
Yeah,
Yeah.
or
And my
Dr.
full name's,
Alex or
yeah, yeah, my full name, Alexandria Rosa. And I
Alexandria
love my
Rosa, right?
name. I
No,
love my name, but it's always like Dr. Alex has always been like the easiest thing
yeah,
that
Dr.
people just
Alex
tend
is
to want to
cool.
call me.
I make them people. I just call like I tell people just call me Dr. S, so they don't have to butcher
Yeah.
the name and all that
Yeah.
stuff. Or I respond. They could call me by my first name. I don't. But anyway, this has been great. I encourage all of the people that are watching this and that like my content. Please jump
Mhm.
over and look at Dr. Alex or you'll find her as Dr. Rosa on
Uh-huh.
LinkedIn. It's Alexandria Rosa,
Uh-huh.
not as Dr. Alex, but you'll find her. I'm connected with her. I follow all her stuff. It's really, you have a very big heart. You're really trying to help people, and
Yeah.
we just need an army of people that
Hmm.
want to do this because the American public is struggling. They're really in a bad position. Every chronic disease is on the rise. Maybe with the exception of lung cancer because of the smoking ban. Other than
Smoking.
that, we're doing really bad with everything,
Yeah.
despite the fact that we have more medication
More.
options, more surgical options, more
Hmm.
chat GPT options, like you mentioned before.
Yes.
We have so many
Yeah.
options, but yet every year that goes by, people are worse off. And by the way, our longevity's gone
Costs.
down. right? If you look at that
Yeah.
chart of America, it goes up, up, and then it's
Mhm.
starting to fade. And so that ain't good.
Yeah.
So we're kind
Hmm.
of failing. And the only way we're going to be able to do this is by educating people and getting people to be CEOs of their own healthcare and taking responsibility and accountability. So thanks for
Hmm.
joining us. This has got, I mean, for this 2.5 hour, tour de,
Oh my gosh.
and we didn't even get into the details, and we didn't even get
It
like
went,
into the details. It
yeah,
just,
it went
it
by
felt
so
like
fast.
yeah, it went by but super fast. One day I'll get to the Elon, not Elon. I was going to say the Joe Rogan, 4 hour podcast, but
Holy moly.
I'm not to
Yeah.
I think that people, I'm not exact, I'm not him. So, people are like, let's keep it under 3 at least. So this has
Uh,
been amazing. Thanks so
Thank
much
you.
for joining us today. I hope all of you guys have this stuck around to the end or watched it in a couple parts because it's so long,
Yes.
but this has been an absolute blast and we look forward to seeing you again.
Thank you. I appreciate it so much. Thank you so much.
You're welcome. Thanks everyone for joining us on another episode of Wellness at the Speed of Light podcast. Take care of your families, be CEOs of
Mhm.
your own health, take responsibility, take accountability for your lives, and let's all get
Mhm.
healthy together. We'll see you on the next episode.